Good evening, everybody, and welcome to the City of Courtenay's March 8th, 2023 regular council meeting. I'd like to do a call to order and begin by acknowledging that we are meeting on the unceded traditional territory of the Comox First Nation, the traditional keepers of our land. With that, I would like to pass it over to Councillor Morin.
Great, thank you, Mayor. Welcome, everybody. I would just like to make mention that today is International Women's Day. On March 8th, across the globe, we join in solidarity and allyship to appreciate the achievements and contributions of women and to continue to work towards gender equity and a world free of stereotypes and discrimination. And while each year we have made strides in some areas, in others we maintain the status quo, and in some cases we regress. It's also important to note that trans women and girls have experienced increasing attacks and discrimination. Trans women are women to be recognized on this day. Society collectively benefits when women have equal opportunities in every level of government, in corporate boardrooms, and throughout our communities, free of discrimination over gender, race, or sexual identity. Unfortunately, the reality is that many women are still subject to harassment, pay inequity, poverty, and gender-based violence, and these challenges have been exacerbated by the COVID-19 pandemic. The United Nations recently warned that progress is vanishing before our eyes, with gender equality now 300 years away. The UN's theme for this year's International Women's Day is Innovation and Technology for Gender Equality, highlighting gender gaps in STEM education and careers and calling attention to the online harassment many women face. Thanks.
Thank you so much, Councillor Morin. And we'll have Councillor McCullum.
Thanks, Mayor. I'd like to raise awareness that March 26th is Purple Day and is recognized globally to raise awareness of epilepsy, a condition that affects over 65 million people worldwide without discrimination. The day was founded by a 9-year-old girl from Nova Scotia in 2008, and people are encouraged to wear purple and host events to support epilepsy awareness. The goal is to promote health and understanding of the condition and create a society that embraces diversity.
Excellent. Thanks very much. All right. With that, Councillor Hillian.
Thank you, Mayor. March 21st is World Down Syndrome Day and is a global event recognized by the UN to raise awareness and promote fair treatment for those with Down syndrome. This day also acknowledges the unique abilities, strengths, and needs of people with Down syndrome and their potential to contribute to society. As Canadians, we celebrate both our similarities and differences, and the City of Courtenay values and supports individuals with Down syndrome and their families to achieve their fullest potential. And I would just add that in my life, some of the moments of purest joy that I've experienced have been in the company of people with Down syndrome, and I lift my hands to them and their families. Thank you.
Thank you, Councillor Hillian. Really appreciate that. And with those things, Mr. Garvin.
Thank you, Mayor and Council. I just want to take this opportunity to acknowledge the very serious matters that we were announcing today. We are really happy to welcome back Ms. Susie Saunders as our Director of Recreation, Culture and Community Services, and we're really exciting to have our team back together. We also want to say thank you very much to Mr. Craig has been giving us Craig Rushton in Susie's absence has been a great leader and great support to the Recreation, Culture and Community Services team as a whole, has been a great member of our senior leadership team during his time with us and assisted council with a number of items over the past years. Just want to acknowledge Craig Rushton for his time with us and welcome Susie back. Great.
Thank you, Mr. Garbutt. I really appreciate that on behalf of council. I haven't been made aware of any late items. So with that, we will move into the adoption of minutes. Thank you. And if were there any errors or omissions? Okay, with that, all those in favor? Oh, Councillor Hillian.
Not an error or omission, Mayor, but perhaps business arising. We did have a presentation from a citizen in relation to Lyric Forest, and I'm just wondering if staff has had any opportunity to follow up with that. I believe there was an indication that one of our departments would in fact be able to engage. My apologies for not giving staff advance notice that I wanted to ask that.
Thank you through the mayor to Councillor Hillian. Just with the timing, we have not yet reached out to the resident to talk about her presentation and comments and opportunities as it relates to the workforce. Thanks. We will be, however, following up.
Great, thanks.
Thank you, Mr. Garbett, and thanks for that confidence. I'll call that vote again. All those in favor? Any opposed? That passes unanimously. And then we get into our delegations, and we have Island Health with us today. Dr. Charmaine Enns, our medical health officer, and Leslie Howie, Director, North Island Mental Health and Substance Use Services. And if you would like to approach the podium, and there's a little button, and after you push the button, I will activate the mic. There we go.
Thank you very much. So you've already introduced us, so I don't need to do that. But I did want to just take a moment to say thank you very much for the invitation. I got very excited to come to speak with all of you. And I just want to thank you for the leadership that I've already seen demonstrated by all of you in regards to our toxic drug crisis and the many challenges we all face in our different roles and responsibilities. So yeah, we'll just get right into it. We have just a few slides and then we'll have questions and discussion. Leslie?
Sure. Good afternoon, everyone. So we thought it would be helpful just to have a few slides, excuse me, to run through the steps that we've taken so far in terms of development of a inhalation overdose prevention site. So I think, you know, one of the things I would say is that we're, as a health authority, we're actively involved in development of a fixed site in this area, and we understand that there's a great need and request from community to do so. And just that fixed location OPS are one part of the continuum of services that we offer in terms of being part of the toxic drug crisis response. And I'll talk a little bit about some of those that are already in place in a later slide. The limitations of the current site, which I think you probably all know, is at 947 England Street, is that it's injection only and it's pretty small and the usage is quite low, and that drug usage patterns have changed over the past few years. So there's a need for a site that would offer protected and witnessed inhalation. Slide. I don't know who's sliding, but there we go. Thank you. So the actions over the last year have been that we were able to secure a commitment of funding from the Health Authority to develop an overdose prevention site with inhalation or to add inhalation onto the current site. We did issue a request for proposals to community in July, and we received a couple of responses to that. The process is quite defined and clear, and of the two responses, there was one that met most of the criteria. And for that one, we did provide an opportunity to seek a location. So one of the challenges that we've been dealing with is the availability of a suitable building or site or location to set this up on. So we gave that proponent time to look and research real estate and leasing availability, and then closed the RFP in August 2022 as they were unable to secure something that would be suitable. And then during the kind of fall and the end of last year, we did review the lease sites and had a number of conversations with your staff around sites that were available. We had our leasing director review possible leased sites in the city of Courtenay and followed up on one of those, but it wasn't available for overdose prevention services. So that was we kind of had to leave that path. We did also review all of the Island Health available buildings. We don't own anything in Courtenay, but we do lease a few options. So we kind of went down a pathway of talking to the owners of those buildings. And 941 England was identified as a possible option with a landlord who would be willing to engage in conversation with us. Slide. I just wanted to take a second to talk about current available access to inhalation, which is on what we would call episodic overdose prevention services. So as part of our outreach services, we have a mobile medical van that we got set up. We developed an outreach team, and they will offer overdose prevention services, harm reduction and witnessing to anyone that they connect with in the community. We also offer episodic witnessing across our locations. So we have a couple of locations at Cliff Avenue with teams there who will witness as the community is around the building. And then also at England Street, although it's not an official site, there is witnessing that takes place outside of the site. Slide. So 941 England has been identified as a possible temporary site. And when we say temporary, temporary to capital planners and developers is a bit different to how we might view it. So it's not for 6 months. It would be built for, to survive the 3 to 5 years until we're able to secure something more permanent. And really the vision would be that long-term, all overdose prevention services would be kind of incorporated into our service location plannings. It's just that as we're trying to catch up in planning those locations, we kind of need to provide service in the meantime. We have reviewed the England Avenue site in quite a detailed manner and had the architect come from Victoria, who's set up a couple of the sites there to look at the spaces available and how he could provide drawings for that. And then at that point started to work with the landlord, given some information, asking to meet. We met with his representative in the community today, and then have another conversation in a week's time just around the building and what our ask is, and then what that will look like. So currently at this time, we're waiting for drawings to arrive mid-March, so next week or the week after, so that we can start to talk in a knowledgeable way about what it is we would be adding to the site there and where it would be, and then to start drawing up the service agreements with the landlord as we needed to. And then at that point, once we have landlord agreement and the architectural drawings are accepted, then that's where we would see engagement with service users, and then also be coming to look at the city for planning review and permits as needed. I think that might be the last slide. Is that the case? Yes. Yeah, so open to questions on this or any other topic that you'd like to bring forward in the time that we have.
All right, thanks so much for the presentation. And I just want to take the opportunity to thank Dr. Charmaine Enns. As long as I've been elected, I think I've had her cell phone number and vice versa. And I just really want to appreciate your openness to not only let me reach out to you, but reaching out to me as well during these challenging times. And so just want to appreciate that and acknowledge it. With that, Councillor Hillian.
Thanks, Mayor. Thanks very much for coming and presenting to us today. I just want to give you the opportunity to maybe speak a bit about stigma. There are many people in our community who aren't really fully comfortable with the concept of drug use of this nature, particularly when they see it in their neighborhoods. And I'm just wondering if you could comment about how a site like this integrates people and other consumers of health services that might be coming through, and anything that you might have to say to help reassure our community how this actually makes things better for all of us.
Shall I start? Sure. Yeah. Yeah, I think one of the things that, we talk a lot about is just providing these health services with as much dignity as we can for the people who require them. We do understand that services are co-located into communities and that there's a need for extensive engagement. And I think that's one of the things that happens around these sites. Often they will have community advisory committees, will connect with local community to help kind of educate, destigmatize, and work together so that we can integrate all the people that need to be within the community kind of safely and effectively. And that engagement is often quite intense at the beginning and then settles down. And I think as far as integrating services, we even working along ourselves to integrate and bring in everyone into services that we can, but do it in a way that's transparent and open to engagement and communication. And those concerns are definitely, as we're building it, taken into consideration regardless of where the site is. Yeah.
So I have a couple comments. I really appreciate the question a lot. And I think this is a discourse that we need to engage in as community in a lot more meaningful way. So stigma is a real problem and a barrier to care and access for a lot of people who need it. So that's why, BC proceeded with the request for exemption under the Controlled Drug and Substance Act to have decriminalization for 3 years. Because the main objective with decriminalization was twofold. One is to reduce stigma, and two, to help move us from seeing substance use with an individual using substances as a criminal or an illegal activity to a health issue. So I think we really have to keep this going to move it to this is a health issue. We are providing a health service. So the overdose prevention site is a health service. I understand that the distress of seeing other people's lives that are distressing to them, I understand that people don't want to see or experience other people's distress, but it's still there if you see it or not. And when we look at the statistics on the overdose, the suspected drug toxicity deaths, most of them, over half, happen at home in private residence. So just because you don't see it doesn't mean it's not happening. So, and why are people dying at home? Again, it's part of that stigma. How do I get service? How do I get access to a prescribed safe supply? How do I avoid the legal system so I don't have my kids taken away from me? How do I keep my job? How do I not lose my friends? There's so much around substance use that that we really have to move that needle. And there's no way forward but accepting that people's lives aren't all like we would like them to be. And that's just why we have to provide the service, and we have to keep people alive, and we have to meet people where they're at so that they can have choices in their life.
Thanks very much.
Thanks, Councillor Helene and Councillor Jolicoeur.
Yeah, thank you, Mayor. And thank you both to being here. It's nice to see you. I did want to just start off by saying and giving my gratitude to both of you for agreeing to come today, and also for working diligently behind the scenes with our senior staff, our city manager, and our outgoing Director for Recreation and Culture on this issue. It is a priority for this council. I think, I recognize that the opinions and the thoughts around how to move forward to address these issues is different in your catchment area in the North Island, and the different directions that other municipalities may or may not be taking in addressing this issue. And I think one of the things that came clear to me in this process was, and we're seeing this across the board in the community, we've spoken about this at previous council meetings, is that there is a lot of concern right now in the community around health, mental health, housing, and this being a part of that. And really just appreciating, I just want to add my appreciation to what the mayor had shared around your willingness to engage with us and to be there along this journey, because I do believe that we're stronger together to solve these challenges. And that looks like supporting the community action team, the Comox Valley Substance Use Strategy, the Coalition to End Homelessness. Many of your staff and Ms. Howie is attending these meetings and is engaging. So I just want to for the public to be aware that we are actively engaged in relationship with Island Health on an ongoing basis and with community partners to be addressing these issues. So that's just my beginning comments, and really appreciate the letter in response to our motion a few months ago around the actions taken and furtherly explored today in the presentation. I guess my questions are really around timeline. I guess unsurprisingly, from what you've been hearing from peers and the timeline laid out 2 slides before this one that we're looking at, really looking at early 2022, this process started internally to Island Health, but really it was a process that was ongoing prior to that for years around trying to get equitable access to inhalation services in Comox Valley. And I get curious, you know, I'm happy to hear that there's some positive steps forward with current facilities that are leased by Island Health. And I guess, you know, not that I want to be the bearer of potentially bad news, but if this process for whatever reason doesn't move forward, is there a plan B? If it does move forward as listed here, what are we looking at in terms of timeline for opening? And then my last question around the timeline is, if we are, let's say, you know, 5, 6, 8 months out from opening a temporary site, what is the plan to address the ongoing harms and deaths that are happening in the community as a result of majority inhalation toxic drug use? So kind of 3 questions all around timeline.
And if you need those repeated, we'll.
Yeah. Thank you for your questions. Yeah, maybe I'll start with the last one first, which I think was around what do we do in the meantime? And I think that one of the approaches that came down as a targeted initiative from the ministry was around outreach and those teams that are out and about in the community and doing that episodic witnessing. So we're just about to extend that a bit further into 7 days a week and then longer hours so that we can provide more it's mobile or moving, but more set scheduling of where people in their community can access those services. And so that will include that range of harm reduction and medical support if needed, and then witnessing. So that's been the strategy that we have been able to implement over time. And I think given the, you know, the human resource challenges that we meet, it's been an achievement to get that team where it has been. So it's really just been deployed over the last 6, I think we started at the beginning of October, so 6 to 9 months. So that's really the strategy there. And then in addition to that, there's the harm reduction policy that Island has across, Island Health has across sites, and working with the strategy team to kind of roll that out so people can access more than just at MHSU, but what if we look at other services in the community and how can we help them access everywhere, which helps with that accessibility piece. If you can just walk in and it's like any clinic, then maybe that would help people access more and not to stay at home. So trying to bring those 2 pieces together to broaden the reach of what we have in terms of overdose prevention now. Timelines are tough, right? And I too would raise an eyebrow at myself because, you know, I know when I became involved in these discussions started. So I wasn't here for years before, but was certainly here, have been here for 18 months or so in this position. And this was the first thing that came across kind of the desk. I went to a CAP meeting and that was the discussion. And then there was kind of responses at that time. So it's challenging to say this would be the timeline now. I think that what we know is that the system is activated to move as soon as we get that signature, and we are quite dependent on that happening in working with the owner of the current site to work with him. So to reassure that this is something that will be okay. It's an extension of services that are there and talking about health services. But there is a commitment there to bring on, we already have like a project manager in place to review the other surrounding buildings to look at, you know, lighting and access. And so he's kind of in place, ready to go, and is starting to pull out these pieces of the project that sometimes it can take a little bit of time to get, like swipe cards and update, you know, what the building needs. So we're just kind of sitting waiting for some drawings now. I would hope, you know, if we're able to activate that within that 3 to 6 month range, we would have something on the ground, or at least be constructing something in that time. because the plans are laid out, but I'm sure that with all construction, there's always lags, but we have models to base it on. So we've had other sites that have been structured and built and put in place in other parts of the health authority. So this is a little bit of a difference from the norm also, because it will be Island Health on, in our vicinity of our offices, and it likely will be run by ourselves and not by a partner in community. Certainly initially we would see it rolling out that way, as that's probably the quickest way is to transition the current site staffing into this site.
Sure.
Because we already have that in place. So we have kind of mitigated some of the delays that we could see happening, because this has been a very extended timeline. Part of that was where would the funding come from, and a lot of these sites were targeted funding initially, and that targeted funding didn't come for Courtenay. So then it was a process of going through the health authority to try and secure that from within our system. Was there something else?
Yeah, just as a follow-up, I guess.
Oh,
to
a
that.
backup plan?
The backup plan, and then so I'm happy that you ended up naming a month, and we're not gonna hold you to that, but because I understand construction and there's a lot of external factors, but if we are looking at a 3 to 6 month wait, has Island Health considered a temporary site so that we can really start to, and I will say that we've heard from our community partners who are running services that also service people who use substances, that there are de facto locations that people are using amongst communities so that they reduce their risk to death and overdoses. And so I'm wondering, if we are looking at this 3 to 6 month, is there anything that we can do as a city, or anything that we can start to support moving towards a temporary site as you're moving forward in this process?
Yeah, I mean, I think the temporary is around supporting those de facto places that we know exist, and working with our community partners to do that. So having the outreach teams in their vicinities more, supporting the staff, because often that's where the stress is for especially if it's with a community partner and the site is there, that it's inserting our staff to be close by to support and hold some of that burden. And that really for now is the temporary plan. Let's upscale our staffing teams and go and help and support where people are, rather than try and invest in another site, because this is kind of, this journey is leading us to, England Street is the temporary site, and the temporary piece is virtual. Like, it's get staff there, let's support our partners, let's try and work together to improve staffing at those sites to kind of take the burden off.
I have other questions, but I'll let others go.
Thank you, Councillor. Councillor Morin.
Great, thanks, Mayor. I mean, I had a question about the timeline as well. I mean, it's really unavoidable. I guess I mostly have comments. We only have one delegation today, so I think and this is just so, I mean, it's so important, and I am going to take a couple minutes to make some comments. And I really appreciate talking about the stigma piece and the rationale for the possession decrim, and looking at this as a health issue. And I really hope that we can move to recognizing that the people we see visibly are suffering, and they're using substances for the most part, to self-medicate due to trauma and mental health. We do have people impacted who are using, recreationally, meaning that they maybe use a bit of a substance every now and then with other substance often, and they're getting a toxic drug, toxicity in that drug. I think it's also too important to recognize that we've had safe consumption sites for alcohol use forever. So people can safely go and consume alcohol with people around them. If someone drinks too much and they collapse on the floor, there's someone there to help them out. But that probably won't happen, because people have responsibility to look after people in establishments. And I know that's not a health care system, but I think it's important to note that we do have this hierarchy of substance use. And if you use one type of substance, you're good to go, and you've got sort of protections around you. And frankly, there's the risk of harm with any substance use, and it's not limited to, I've heard the term hard drugs mentioned many times. Some people who use hard drugs, you'd never know, because they take a little something and they go to sleep and they don't bother anybody. So I think we really need to get away from the stigma of the types of drugs as well. And not all people who are unhoused use drugs, but those that do have nowhere to go. They don't have a home to go to. And as Councillor Jolicoeur pointed out, the piece around people congregating is for safety. I've spoken to folks who are unhoused, who were sleeping in the rough out, in more isolated areas, and saw far too many people die. And so now they're congregating in those more public areas because they're trying to watch out for each other. And with that, comes these other complications that we're experiencing. But really, it's all about safety. And I guess maybe the last point that I'll make is just, I know this was my job before, so I do have that lens that's a little bit different, but I just almost, if not daily, weekly, imagine if that young hockey player I knew, who was so funny and talented, had felt that there was a dignified space for him to go use, so he didn't have to hide and die alone and his girlfriend find him. And imagine if my family member's mom, who had recently reconnected with her kids and had just received a job offer and was just moving into housing after being unhoused for about 4 or 5 years, had just transitioned to that. Imagine if she'd had a place to go. Imagine if the woman I used to see around town, who was always cracking jokes with everyone and putting a smile on people's faces, and would give out little trinkets and things like that, and had recently heard that that she was going to get into detox. Imagine if she had had a place to go. So every person has a story, and I'm not trying to be melodramatic here, but I think it's really important to recognize that this is a safe place to hopefully help people transition to those things that I talked to have a point of connection where there are caring staff, where they don't have to be in secret, where using an opiate or using another substance is treated the same way as other substances that cause equal or even more harm often. So I just, the timeline is discouraging. I don't know what we do about it. I don't know what the solution is, but we certainly have people who are, who just don't have an option. And if they did have a safe option, we would be noticing the difference. So, yeah, that's all I'll have to say. Thanks.
Thanks so much, Councillor Moore.
So every community has struggled with finding locations for OPS. For this particular community, our struggle has been landlords. If we can own a place, it would be way easier because then we have some autonomy, right? So we are so thankful for the collaboration and the support of Mayor and Council and the city. Amazing. We have Island Health that's completely committed, but we need a space. So, the timeline is discouraging. We had the previous OPS provider, which was one of our partners, also couldn't provide inhalation. Then now we have the OPS and we're struggling to get inhalation. So we all want it. We just need a space to make it happen that's in the right place with the right provider, and that it can be accessible and it's appropriate for the people who need to access the service. I just have one quick comment about, Leslie made reference to a continuum of services and other services, and I'm absolutely committed to having an inhalation and OPS services. We need that fixed site, but we also need to remember there's a whole bunch of people that are using substances that will never come to an OPS. And across that continuum of service is prescribed safe supply. It fits in there too. And in the North Island, Health Canada has funded for a prescribed safe supply through AIDS Vancouver Island. And then so right now, in both Campbell River and the Comox Valley, there are people who are enrolled in the program and getting a prescribed safe supply so they don't need to access the straight supply, or they access less. This started late in the fall, and some early results are coming in. I want to share it with you just from what I can remember from my head because it's so encouraging. So it's anecdotal right now, but a focus groups and evaluation from 20 of the participants. The response is overwhelmingly how it has stabilized their lives. They have less need for street substances or any street substances. They have less withdrawal symptoms. They have less cravings. Their lives are stabilizing in terms of being able to access social and health services, which means they're getting care that they weren't getting before. They're now able to get housing. They're able to access services. They're actually able to continue on in relationships that were a challenge to participate in before, but now they can. And the mental health impacts have been quite significant in that they have a sense of hope for the future, that they see promise, that one person has gone back to college. Just the whole incredible breadth of stability and hope that our people have when, and also they're not having to participate in the street economy, which means there's no need to interact with the police or that's a criminal system. So the benefits from the prescribed safe supply for people who are opioid users is significant, but it's a very small program. And we have a lot of work to do to make that more available. But it's another stigma issue we have to get around. Let's face it, we hand out drugs hand over fist in the hospital. Nobody blinks an eye about that. So, so we need to provide the right service for the right reason to the people that we provide care for. And I think prescribed safe supply is one of those really important continuum services that we really need to expand, but it'll hopefully make our need for OPSs less.
Thanks so much. I appreciate those comments, and I'll pass it over to Councillor Gilliger.
Yeah, just because and thank you for your comments, and to Councillor Morin for really bringing in the stories of the people that we're advocating for here. Because we have the both of you here, there are, and I know that we've been speaking about inhalation services, but I have two questions. One pertaining to harm reduction policy, and I know that we don't have our acute care colleagues here, your acute care colleagues. Anecdotally, we're hearing that there continues to be resistance in providing patients in our acute care setting here in Comox Valley with overdose prevention services in the hospital when they're, say, going to the emergency room because they have a wound that needs to be treated. And these are individuals who have substance use in their lives. And anecdotally, we're hearing that there continues to be resistance from staff and from a policy perspective of implementing that. From what I hear, there is a island health policy, but there's some issues with the implementation. We're hearing people are having to leave Island Health property to go use. And so I'm wondering, I'm really happy, Dr. Ains, that you spoke to prescribed safe supply, because we theoretically would have patients attending our hospital who have prescribed safe supply who need to access that safe supply because it's a prescribed medication that they're using for their health. And so I'm wondering if you can speak to that. And just because I have the mic, my second question, because it'll likely perhaps be Dr. Ains answering this, we've been extending a fair bit of political capital to move some of these issues forward. And again, not, perhaps a little different than some of the other municipalities that you work with. I'm wondering if you can speak to specifically your role in supporting municipalities in addressing policy changes around substance use, say in public spaces, and how you see us working together as decriminalization, safe supply, as substance use continues to impact our community. So I'm wondering if you can speak to your role and how we work together.
Yeah. Yeah, thank you for that question. I think that I can only voice agreement. We know that in some places where we're struggling to consistently support and roll out that policy. We are involved, I say we, so mental health and substance use and our addiction medicine consult services are actively involved in conversations with the sites to try and support acute care in their movement. So just like we have to move, our society has to move, our municipalities have to shift. For acute care, there are challenges there. I can only recognize it, but we are in kind of active communication and support with the acute care sites, both North Island Hospital sites anyway, to try and shift some of that. I would say that, you know, as individual people come forward, cases are highlighted, then that gives us an opportunity to discuss that specific piece. Our addiction medicine consult services, they are available to consult with MRPs in the emerge room, but they may not always get called, which could leave people in a difficult situation going into withdrawal or require an assessment that they don't get in time if they're waiting in emerge. So we're really working to like bring those two streams together and let's try and lift the baseline up as people come into emergency. But I would just encourage, as you know, as issues come up, for people to bring them forward and connect. And if that's a connection with me, then that's fine. Just to do that and encourage people.
Yeah,
I know that that's myself.
Just as a follow up to that, I will say, you know, because I'm kind of anecdotally the person that people have been reaching out to on this is, you know, if a patient comes into the hospital and, you know, the assessment is, what meds are you on?
Mhm.
And patient says, I'm on heart meds, I'm on diabetes meds, I'm on antidepressants. I use opioids. And there is this sense of an institutionalized stigmatization of people who use one type of, again, a drug.
Yeah.
Again, and Dr. Ains, you spoke about how in our healthcare system, we hand out drugs of all sorts to people. And so, you know, I have received emails. I have heard today from a patient who is accessing the hospital, and that they were the ones that mentioned they were, you know, encouraged, yes, go use, but you have to leave the property. So this is someone who is in the emerge for a medically acute reason. They are on medication, an illegal substance. This person was not prescribed it, but they're using the street supply, and they're having to leave the emergency to go and stabilize themselves. And so there's this kind of semblance of, you know, and I'm appreciating that we're trying to eliminate stigma in the community. But there feels like there's a conflict when people are going to get the help they need in an acute medical center. So.
Yeah, and I think there is a conflict and there is a need to work through it, to work through that stigma within our own systems. And, you know, we have, it's a person to person approach. And we do have addiction medicine consult. We have nurses in who are in emerge who will be supporting that, but they may not be there at that time.
Right.
So I think it's really building up that connectedness piece and you know,
A culture shift inside the hospital too, right?
it's like if we get to that level, suddenly the cultural shift, and we'll be like, oh, there's no big deal here anymore, right? But I know we're not there. Acute care knows, the site knows, the leadership knows, and we're working through it to really make a shift. And I think there's two ways, right? There's always the policy and the guidelines and the education, but there's the person to person and having people supported to come forward and then address those concerns. And we will do that. Like if people are willing for us to, you know, share information or support them in a certain way to get that, then we'll get those needs met. And that person to person is how we'll stack it up and hopefully build that shift.
Thank you.
Me next. The question was how to engage. How do I engage? How am I useful? How am I anything? Was that it?
Yeah, I mean, we're getting, the topic of decriminalization is top of mind. We've got a lot of emails, a lot of concerned citizens around what does this mean?
Yeah.
Right. And I would love to hear from you around your role and how you see us working together to support this new reality in our communities.
So I'll just take us back a wee step to say I have a role even without that to support and to be collaborative with you as local government. So under the Public Health Act, we have obligations. We have shared obligations to be speaking to each other about decisions that may impact the health of the population, especially in regards to bylaws. We also have legislation through the community care. Not community care, community charter. There's too many acts and regulations. So there's the Public Health Act, the community charter, right? Those are the legislative things that says we must work together. And my job, of course, I have no power or interest in trying to tell you what to do. My job is to provide independent advice or evidence to support you. And that might be from me directly or through staff that I work with. That might be to you directly as council, but more often that's working with the staff. So I am very willing and wanting to participate in the discussions. And I know there's some upcoming discussions that I'm very thankful to be included in. So it's not a rigid thing. It's really about, because I don't know what all of your particular or specific concerns on. If it's not brought to me, I have half of the North Island. I have half of the island under my as my area of responsibility. So the whole top half of Vancouver Island. So and under the Public Health Act, there's supposed to be a delegated staff person that is the direct liaison to make sure that we're equally informed about issues that might in fact impact the health of the population as it pertains to your roles as local government. So I'm not sure if that's answering the question.
Yes.
Okay.
All right, thanks for that. Mr. Garbutt was going to just speak to maybe some of the things that the city can be doing around timelines as well. So, Mr. Garbutt.
Through Mayor Council, thank you for the presentation. With respect to any approvals that are required for renovation to the subject property, I've spoken already to the Development Services Department, and we can prioritize those applications. We're cognizant of the timeline. We've been working closely to identify options, and our phone is open and ready to go if and when any permitting is required. Based on our current discussions, it's not totally clear at this point if we are even involved in any kind of permitting activity with respect to buildings, etc. But if they are, we'll prioritize these actions.
Excellent, thanks for that. And sometimes the province does just do things, but I think given the conversation we're having tonight, I think it was just really important to make sure that it's absolutely clear that the city is right here as a partner to make sure this happens. So, and I think you knew that, but still, Councillor Moore.
Just another quick question around landlords. I understand the reluctance for folks. It's an unknown thing. I mean, it's not like there's lots of people renting out spaces for this. Is it within your role to have conversations with landlords about what exactly this service looks like and allay maybe some fears around that?
Yes. Don't think. Oh, there we go. Yes, it is within our role. Do you mean more broadly, as in?
Yeah, I mean, if there's someone
broadly
out there who,
right,
maybe is listening or watches the meeting or reads and says, I have this space, I do have compassion. I liked what these folks said in the delegation, made sense to me, but I'm really kind of concerned about what that would look like. And would that be something that you would be able to provide a little bit of education and liaison with?
Yeah, I think if anyone is interested or has connections, like really in terms of partnership, happy to talk people through it, to explore the building that they have. If you happen to have something that you'd like to rent, then, in the right area, then, we're able to look at partnership in that way within our communities and have done it. So yeah,
Mhm.
happy to have anyone reach out or ask questions or.
And I just want to say that I know that the safe consumption site that we have right now is not that well utilized, but I can tell you that I mean, you wouldn't even know it was there. And I know we have more people using inhalation, so we would want it to be busier. We'd want people to be in that safe environment. But it doesn't necessarily mean that, I mean, it is staffed there, people are going in and doing and, leaving. So I think there may be some concerns that people have that are just not the reality. So thank you.
Yeah, thank you.
Thanks, Councillor Warren. Yeah, did you want to speak a little more? Well, we haven't used up.
Yeah, I would just say that if there, one of the things that we've just chatted a little bit about is that if there is a wish to have a smaller ongoing conversation with Charmaine and myself, with a couple of members of council or staff, then we're happy to commit that kind of time to have the conversations as we move through the process, so that you feel up to date with what we're up to.
I really appreciate that, because I know I get to talk to Charmaine on a well, whenever actually it feels like, but then relaying that to staff and other council members can sometimes be when you're full of meetings all day long. But no, I do appreciate that. That has generated another blinky light, so I'm going to pass it over to Councillor Jolicoeur.
Just thank you, Mayor. Just to give notice to our health colleagues, our health system colleagues, that and because Dr. Enns spoke to and Ms. Howie spoke to the continuum of mental health and substance use services with the provincial recent budget, you will see a notice of motion on our agenda today for the March 22nd council meeting for us to discuss advocacy to, hey, we're putting up our hand. We want some of the funding for treatment beds, for recovery beds. This is something that our community is saying, what are you doing about this? We need to get folks help, and we don't have those supports necessarily here in the community. So I did want to just inform you that that will be coming to council at the next meeting for discussion and debate.
Thanks so much, Councillor Jolicoeur. And I've got now that I think we've talked about the discussion. We haven't used up a whole hour just yet. So my question is more on some of the steps that are coming. You alluded to the fact that we're going to have a community meeting coming up through our BIA, but also we're starting the situation table. And I don't know if you're able to speak to that or, to me, it's another tool that I think it's important for people to understand that that's something that is just starting and kind of what we might be able to expect from that. And I know it's out of left field, but if you're able to speak to that.
I can speak to a small amount. So there's obviously a commitment to join the table. I think where I've seen it function well, so Campbell Rivers is more established, is that ability to bring forward in a way that brings all of the partners to the table, and we're able to sit and have those more open information sharing conversations that sometimes we're not able to have in terms of the freedom of information, and how health services are kind of protected within that act and legislation. So it brings an ability to come to present someone anonymously who's a concern within the community. And then there's a system of being able to say, yes, this individual that you're talking about, we know would fit the criteria for this. And then there's a next step where the information is brought, the agreement is signed between the parties around this individual, and then information is shared. And then there's quite quick follow-up at that point in terms of who will go, the invitation to services, come up with an action plan. And it really has had very positive, feedback and results, I think, in other communities. So it's great that it's coming, and there's a commitment to have a fairly hefty presence at the first meeting from Island Health. And then what happens is really you need the people who are out there doing the frontline work and are already connected to the community out there, and folks that are coming to use those relationships and connections to kind of give that extra reach out and meet people where they are. So yeah, it'd be very positive once it gets moving, I think.
Excellent. Thanks for that. And the last thing, and it's really around advocacy and capacity. And, you know, our council has been very adamant and I think loud when we're speaking with our MLA, with our MP. If we're talking, have the ability to talk to the ministers about these needs that we have, and really just so that we're saying the right things. I mean, maybe there's some words we can be using or targeted in some sort of way, because there seems to be potentially a funding side of things, but then maybe also a capacity side of thing when it comes to the challenge that we're really trying to address here. And so really just looking for a tiny little bit of insight, if you got any comments on that.
Oof. So the question is.
So if we're talking to upper levels of government, because frankly, most of what we've talked about for this last hour is not traditionally stuff that, you know, municipalities have had to deal with. And so we're often talking to our MLA, our MP, ministers, whether they be provincial or federal, and really trying to advocate for the things that are needed for those frontline workers. And does that help articulate a little bit better?
Yeah. So I'm a public health doctor. So of course I want to prevent, or I want to make things better. You know, I don't want things to end up where they need that big intervention. So Leslie, you might have another comment, but I think one of the things we need more than anything, and I don't mean to oversimplify it, but is appropriate housing, supportive housing, appropriate housing. People have to be stabilized with housing. I think that's not going to fix everything, but it is, from my perspective and my knowledge, it is a key essential determinant for people to be able to go on. So one of the things, of course, within the health system is generally, we call it a health system, but it's really a sickness system. And it's really all about reacting to when something bad has happened. So try being a public health doctor in that kind of a system where you're trying to say, no, I actually want to not have that thing happen in the first place. Let's do what we can to reduce the likelihood of that happening at all, which is why we put so much energy into getting people vaccinated and stop smoking and, you know, get out there and exercise and eat your fruits and vegetables. Those things actually make a difference. But we need to also, in the investment request, I would ask that it not just be focused on the end of the spectrum intervention, that we also focus on some prevention and support for young families, what it means for kids, and that we think about the more holistic approach, and then the interventions that need to happen. If we could shift away from this segmented, targeted, sporadic interventions, because everybody wants to do something to help things better, we can get more concentrated on a holistic primary care system that provides a more unified and comprehensive service. Maybe so that it's not just we have to go there to get your prescribed safe supply, but you have to go over there if you're thinking about treatment. You have to go over there if you want to get your if you want to get your OAT. I mean, so we need to bring it all together somehow for the intervention piece, and then we need to do the prevention piece, but let's get people housed.
Thanks, I appreciate that.
I have nothing to add.
All right, and you guys have had almost an hour, so and well, you got 10 minutes to talk. We get to talk really as long as we want. I think that's the but I think, you know, this is certainly something that I believe all of council, you know, it's what we get asked about probably the most right now. And I don't want to speak for the rest of council, but I believe I can say that everybody's very passionate about this and really wants to affect change in a positive ways as quickly as we can and in the best way possible as well. So with that, I just again want to thank you for coming today and presenting and for the work that you're doing. And I'm sure we'll be talking soon.
Thank you. Thank you.
Thank you so much.
All right.
Now.
Okay, that was a great conversation. Moving back into our staff report for the advanced budget approval for bylaw enforcement officer. There's a recommendation, but Councillor Henley.
Thanks, Mayor. I'll move that council provide advanced budget approval to initiate recruitment activities to fill new regular full-time bylaw enforcement officer position prior to the adoption of the 2023 financial plan.
It's been moved and seconded. I'm going to pass it over to Mr. Garrett.
Thank you, Mayor and Council. Ms. O'Connell is going to do a short introduction, and then I believe Mr. DeGraff is going to give an overview of the report.
Okay, thanks so much.
Thanks, Your Worship, through you. So I'm very pleased to introduce Mr. Peter DeGraff, who is our Manager of Bylaw Services. He'll be speaking to the operational need that's been identified within the report and is leading to the request for advanced consideration of the budget approval. And then I'll kind of wrap things up with a bit of an intro on some really exciting things we've got coming down the pipe in bylaw services. Yeah, so with that, over to yourself, Peter.
Thank you, Kate. Through the mayor to council. Purpose of the report is to request approval from council for advanced budget to immediately hire one new full-time position in anticipation of increased seasonal and general service needs. The position is identified in the 2023 budget. We currently have 2 full-time bylaw officers and a manager position and a little bit of monies for casual work. This new position would increase the staff to 3 full-time bylaw enforcement officers. So why? Overall demand for bylaw services has been increasing significantly in this community. I'll paint that picture in terms of 3 service deliveries. 1, the proactive homeless encampment program. 2, the proactive parking program, which was reinstated last fall. And 3, the calls for services program. And that's your complaints coming in from the residents of Courtenay, parking complaints, unsightly properties, noise, zoning, environmental investigations, home occupations, etc. So the 3 general service deliveries of bylaw services. So in terms of the proactive encampment program, the extreme weather response shelters will close later this month. And what that means is level of service will go up significantly. So currently during about from mid-November, December to the end of March, we provide a service level of 3.5 hours per day, twice a week to keep the level that is currently at. What happens when the shelters close, the demand for services and the number of persons experiencing homelessness increases significantly in the first week of April, which happened last year. So what we do is we increase the service level to 3.5 hours each day, 5 times a week, and it's 2-person teams. So in our terms of our protocol, health and safety, we have a requirement for a 2-person team. So what this amounts to come April right through at least to the mid-November is about 44% of the current bylaw enforcement officer capacity. In terms of the proactive downtown parking patrols, level of service is now up to 4.5 hours per day, up to 4 to 5 days per week. So that's about 28% of your capacity. So right there, you have about 28% capacity left under the auspices of 2 bylaw enforcement officers come April 1st through a good part of the year to handle the calls for services provision. And again, those are the things like the unsightly properties, the wood burning smoke that's coming up, the building bylaw, secondary suites, noise, parking complaints, etc. So what will happen is services will start to get backlogged, and the response time, which is basically a function of the number of staff you have and the incoming calls for services, will be impacted. So that explains why. And just one more thing, so you know the value for money that you're getting. We have built, I would say, basic performance indicator systems. That's new. 2023 will be your base years, but it's new. I would say it's fairly comprehensive, but we look forward to showing you that. And again, 2023 is the base year for evaluating these services for all sorts of reasons, for the allocation of resources, for efficiency, for effectiveness, for better quality control, your value for money. So that's up and coming as well. Thank you.
So just to kind of continue on some of the exciting things we've got coming, that'll be coming before council over the coming months regarding bylaw services. We have engaged two separate consulting firms to assist us on two very significant projects that are going to help to shape how the city is looking at bylaw enforcement, specifically within our parks and public spaces, as well as reviewing our bylaw policy. So what is our identity within the community? What is our role as a bylaw compliance agency? And what do our objectives look like? So the modernization of the Parks Control Bylaw, council will be getting its first report on this subject matter at the next council meeting. So we look forward to presenting that. And that is really a review of some key priority areas within the Parks Bylaw, specifically looking at things like smoking, sheltering, protection of natural resources, protection of reconciliation or culturally important or significant locations, as well as some information or updates around public usage. In addition to that, I mentioned that we will be working on the bylaw compliance strategy. So the policy will be first. So that's the who we are and how do we determine what the priorities are. The compliance strategy is how do we go about responding to bylaw complaints in a way that is consistent and effective. And then the last part is creating a good neighbor guide. So how do we make our bylaws accessible to the majority of the public who may just not be aware of some of the rules we have in place in order to make our city a wonderful place to live and to be good neighbors with each other. These approaches have been extremely effective in other cities such as Abbotsford and the city of Surrey. And we have some wonderful contractors that are coming on board, have already started working with staff, internal and external stakeholders, as well as Peter and myself. And yeah, it's going to be a lot of bylaw over the coming months with the target of having all of these new processes, policies and bylaws in place prior to the summer months. So with that, Peter and I are both happy to take any questions.
Excellent. Thanks very much. Councillor Warren.
Great, thank you for the report. So in terms of timeline, sorry, I'm trying to find it here. When would, I know you said I'm thinking about the Good Neighbor Guide. What's sort of the timeline on that work?
Thank you, Councillor Warren. That work will be within the next 4 months. So we'll start with the policy. Once the policy is drafted, then we'll move on to the compliance strategy. And then from there, we'll be able to do the Good Neighbor Guide. One of the pieces is the Parks Control modernization process will heavily inform the Good Neighbor Guide. So we need to get that piece done first, and then the communication piece will be at the end once we've updated everything.
Because I'm thinking mostly around communication. I know when I was campaigning, I answered a lot of those logistical questions around who do I call for this and that. And I was trying to give people all the correct information, but I thought if we were able to align the timing with tax notices and things like that for some of this information, I think it would be really helpful, because just, to have more clarity around these particular issues. So I don't know if that's a reasonable timeline or not, but
I can't speak to that timeline alignment necessarily, but what I can say is I'm actually currently working with our communications team to create a landing page on the website that will do exactly that, where we identify the projects that the bylaw department is undertaking. We'll provide a central page that identifies which authorities are responsible for what. And then that way folks know who to call when they encounter things like graffiti or garbage or illegal dumping, or anything else that they may come across within the city. I know myself, as well as the Director of Public Works Services, we've worked with the DCBIA on something similar, one-stop shop, to provide that clarity. So we'll do that through the website first and foremost, and then we'll definitely look for further opportunities to raise awareness around who the appropriate authorities are to call.
yeah, thank you. I appreciate that. And certainly we do have people who follow, all those communication. But I mean, it's always surprising to see how many people have like our recycling guide tacked on their fridge, or people who are not online at all. And yeah, that was a little nod to our, our public works staff. But I think people would like to have something that was accessible in paper form, or, that kind of thing. So just putting that out there. Thank you.
Thank Councillor Morin, and having seen the document, the DCBIA is, I mean, it is a printed document and seems to be very well received. So Councillor Jolicoeur.
Yeah, thank you, Mayor. And I guess I'm just really excited because this is a little bit of a hint for the first time that the public is seeing what we have been working on behind the scenes and what staff have been working on behind the scenes around our 2023 budget. And so really happy that there's this is coming forward as a proactive approach to addressing an imminent challenges that will be occurring once the emergency extreme weather response shelter closes in a few weeks. I guess beyond my comment is just more of a technical question. I really appreciate because, you know, the campaign, similar to Councillor Morin, people did have a lot of questions about bylaw. People are continued to send correspondence to council around, you know, some of the issues that are being experienced in the community. And I appreciate that there's been a breakdown of a percentage of bylaw enforcement officers' time. And I imagine that some of this is from previous years or kind of patterns of what capacity is used for on a weekly or daily basis. And I guess my curiosity really lies with specifically, and you didn't mention it in your opening, but it is in the staff report, the wood burning smoke inspections, and it's highlighted here as new. And that whole section is kind of lumped in with all the other smaller, I guess, less common, at least in terms of responsiveness around noise, zoning, hedges, weeds, tall grass. And it's kind of lumped in there under the 28% of our bylaw enforcement officers capacity. And I'm wondering if you can speak to, because it is new, if that's obviously a projected, and if you can kind of maybe just spend some time speaking to that. And this is, I guess, the first time the public might be hearing around what that bylaw enforcement would look like as well, specifically the wood burning smoke inspections.
Yeah, thank you. Through the mayor to council, that report has been recently passed and we're in the process of developing the systems for that. And right now we're developing communications on it, a public awareness thing, you know, and there'll be a grace period. So the approach is through education first, obviously, in order to achieve voluntary compliance. And, you know, and then enforcement activities that we have to go to that as a last resort, you know, then we would follow up with that. But the idea is to give a grace period, probably till at least the fall, to educate the community on the issue and the intent, council's intent.
To that, summer months, theoretically, people are doing less wood burning if they're using it to heat their homes. And so I do wonder if that's a realistic timeline for a grace period. I think we're transitioning away from high usage of wood burning appliances. And so, yeah, just something as you were speaking that I'm wondering if we come to the fall, it might still be the first time people are hearing of things. So just a comment.
Yeah, through the mayor to Councillor Jolicoeur, I mean, we are moving forward on a strategic initiative that council has been extremely vocal on. When the deliberation was happening on the creation of these regulations, there's a lot of concern about the potential implications for people as we transition through this. As Mr. DeGraff had talked about, ticketing and enforcement action is our last resort, and we would have good materials together to help work with people. But if we have people who are going to be burning not in accordance with this, the word grace to me, with all of my years in bylaw enforcement, we will work towards that. If we have bylaws that need to be enforced, we will. But the people who do burn wood as their primary heat source, they are very well informed and they're very aware of where we're going on this. And we really hope that the materials have been developed and the regional coordination, because that's the implementation of the regional plan, is that it will be out there and people will be aware. One issue though that I'm envisioning we will run into though is the interface between electoral areas who don't and have not introduced any regulation here. And that will be difficult for some residents in Courtenay to accept. The monitoring that Mr. Davidson's group will do with the purple air monitors is going to help us with that. But I just want to be clear that we are heading into council directed activities. Will be extremely reasonable in where we go, but there's going to be, there will be some time, but technically there isn't, when we have bylaws and we go down the route where we are no longer unable to gain voluntary compliance, that we may be in some enforcement activities. So.
Yeah, and I think, traditionally that's how bylaw has worked, where it is compliance, and then if compliance is not a possibility. So I have the utmost confidence, but I appreciate the question, Councillor Jolicoeur. Councillor McCollum.
Thank you, Mayor. Yeah, I'm just happy to speak in favor of the recommendation and the report. And I think it's great to see this coming proactively in front of the budget to make sure that we're able to respond to the changing needs of the community in terms of our bylaw of response. I mean, something that does occur to me is that, or it highlights for me how there's so many things that we're needing to address at the city that has an impact from downloading of responsibility from the province. And this is definitely, it fits into that we're looking at housing services that are provided by the province, that they pick a time when it's no longer funded, and then it's back to the city to have to respond to that. So, but of course I do recognize that that's a need and that we need to address that. And then the final comment I wanted to make is just, we don't see you at the table here, Peter. So I just wanted to take the opportunity to thank you and your staff. Anytime we speak about bylaw in the city, it strikes me just how much the landscape has changed in the 5 years that I've been at the council table in terms of needs in the community and expectation of what our citizens want from that. So I just want to recognize that it's not easy work that you and your staff do. So thank you.
Thanks, Councillor McCollum, and I'll echo those words as well. And I think this really actually shows a couple of things. If we again go back 5 years and we look at what bylaw looked like, just in the number of people that we had in bylaw, in terms of again, if compliance wasn't met, there was, I think, really a challenge of getting those teeth done. And I think staff have really stepped up to modernize our bylaw. For sure, we've staffed it up. This coming forward, again, this is a priority of council. And so I just want to thank staff for really not just piling people in there or, coming up with ideas, but actually having a great plan that's been frankly executed, I think, quite well. So again, just really want to thank you for that. We do have a motion on the floor. No more questions. All those in favor? That's unanimous. And we'll move on to development services for Ace Brewery Company. And I'm going to pass over to Mr. Carbon.
Thank you, Mayor and Council. We're back with the results of the public notification on the Ace Brewing Company Limited liquor license application. We have one of our planners, Mr. Devin Cronin, is going to give us a little bit of an overview. We do have the applicant here who will be available to interact and be involved in the discussion if required, and will be provided an opportunity if they want to speak. So through the mayor, I'll turn it over to Devin. And I think this might be the first time Devin is interacting with you folks directly, and we really appreciate the opportunity to get our staff working directly with council and representing their files to you all. So thanks, Devin.
Perfect. Thank you for having me, and yes, a new face to see here. This is the second time you will be seeing this application for the public notification result for the liquor license application for Ace Brewing Company Limited at 150 Mansfield Drive. There's two pieces that the applicant is looking to get here, and that's a structural change with the permanent inclusion of a temporary patio at the location, and a change in their liquor service hours. So in the council report, we have included all the public notification materials that we have received within the, I believe it was a 3 week period, 3 to 4 week period, where we were accepting comments. And essentially, on here, if council has any questions regarding the zoning, any other planning pieces.
Excellent. Thanks, Devin. I don't see any lights on, but I just want to acknowledge a couple things. Thanks for the great report. But the owner of ACES is here as well to answer questions if council have any. And really want to acknowledge that, in the report, there was some concerned citizens and the owner did meet with folks that had created a petition. And so that was hopefully a step in the right direction. So with that being said, Councillor Hillian.
Thanks, Mayor. This is one of those situations that is difficult to deal with because it's not really our decision to make. We're involved in a public process that goes on to an organ of the provincial government, which will decide on this one way or the other. So, while we may feel a lot of concern for a business opportunity, a successful business that wants to expand, we might also feel concern for residents who, if there is any consensus in the feedback that we've been received, it's that most people have no objection to the permit becoming permanent. Most people don't seem to have an objection to the expansion, although some do. But I saw fairly widespread concern about the extension of hours. So, I tend to agree that we should send this along to the Liquor Control and Licensing Board with the comments of the public, and it is up to them to make the decision. I am curious though about, first of all, many people are saying, why does the establishment need to be open until 1 o'clock every night of the week? There's also questions about the possibility of a sound attenuation system of some sort, some type of fencing being installed. So I would be interested in hearing more about that before determining how we proceed with this. Thanks.
Okay. John, did you want to answer those questions? If you approach the podium there and just push the gray button on the front of it, I will fire up that microphone. And are you ready to answer? Do you need the question repeated?
Can you hear me? Yeah, there you go. Just to clarify, the application for the hours from being 9 a.m. till 1 a.m. daily is just a broad blanket for the hours. It does not mean that we intend to be open to the public from 9 a.m. to 1 a.m. For one thing, it is not a good decision business-wise to be open those hours, and also it's not very friendly as a neighbor for our neighboring the houses across the street, the apartments, the condos there. It's the issue that we've had in the past is that people coming in the morning. I'm there usually very early in the morning, pretty much 7 days a week. Mainly in the summertime and in the winter as well. During the holiday season, we have people that want to come in and do, purchase off sales, and we cannot sell before 11 o'clock. Therefore, a lot of those patrons are going elsewhere to buy our beer, but at a liquor store. And then also housing events. We found that a few of our events we had to cut short because of of the actual sale of liquor. We've also wanted to have special events that ran past our point of sale or time of sale, and we would have to get a special events permit, which would be $350 each time, and it's a little bit of a lengthy process. So financially on that end, it's not really feasible for having that. So it's just having an opportunity to have a more business opportunities for events, and we do sponsor a lot of sports leagues that come into the brewery. And, you know, if they're coming in, a lot of them actually are Thursday is one particular night that we do have a lot of our events, or sorry, our leagues coming in after their practices and games and that sort of thing. You know, if it's 10 o'clock, there's absolutely no alcohol being served, and we're very diligent about that. And we have had elsewhere where there's been events and we've had to stop selling alcohol. People have left, and we know for a fact that they have gone to other establishments, and you know, because they want maybe have another beverage. So it's not saying that we will be open those hours daily. That's not our plan at all. It's just more having more flexibility as a business to stay open and not have to go for a special permit. And I believe there's another question to that as well. Sound.
Sound attenuation.
So for the sound, as in for the hours, is that what you're speaking of?
Well, and I think maybe just when we were meeting with the residents there, you had spoken about hedges and walls and stuff. So it's just, how do you keep the sound from traveling the way that it is right now?
Yeah, so for that patio, we were wanting to basically twin it to what the patio is, the permanent one that we have now, and have it so that we have solid walls on it. And one thing is after our discussion as well, we're talking about, you know, maybe the height of the wall or the fencing, sorry, around it. Also is having foliage and including shrubs, trees, that sort of thing. I know now we just have some potted trees there. The majority, they're deciduous. We want to get more evergreen. And if we are allowed to have that patio become permanent, we're going to make them actually a permanent. We're hoping to go and actually dig into the ground and actually plant those trees so that they'll grow and they'll flourish. And also add more trees there. And also what we've done on our other patio is have hops grow. And so hops grow very, very quickly in the summer months. And then having them along, and they'll help as well as the barrier.
Is that good, Councillor Henley? Excellent, thanks. Councillor Joker.
Yeah, thank you, Mayor. And thank you for actually being here, because it was really nice to hear that you were able to meet with some of the residents who shared concerns. And I did want to just speak to the process in general. You know, the Liquor Board does look to us for support. And although the decision doesn't lie with us, I think the letter that we send goes a long way to a quasi-judicial regulatory body that's really just regulated through one piece of legislation rather than a municipal body. And so I would say that our letter does go a long way. I think the other thing I wanted to speak to around process, that the process of notifying the neighbors has worked in this case. And so I just want to speak to my appreciation for the residents in the surrounding neighborhood who took the time to write us. It's in the public document for those of you who are interested. The research that's been done, citizen research, like this is democracy really in action. And we were able to, Councillor McCollum and the mayor and myself were able to meet with some of the residents to listen to some of their concerns. And I know that the mayor met with the proponent and the residents to try to address some of the issues that they've raised in their correspondence. So I did want to just speak to, you know, however the outcome of this goes today, just my appreciation for the process in that, you know, the notice went out and we got feedback. So it's working, right? The process is working and a lot of ideas came forward. Some of the ideas that I heard from residents that I think for me seemingly seem amenable, and I'd love to hear from the proponent, you know, and I've seen this as a patron to many establishments that are in close proximity to residences, is just a notice somewhere, maybe as as folks are leaving saying, hey, we've got neighbors, just, be gentle with your voices as you're leaving. That was one of the major concerns that the residents brought forward, was that although the current liquor license stops, obviously you're not kicking people out. People are enjoying your food, delicious food, if you haven't checked it out at Ace Brewing, and they're enjoying their time, right? But then they're congregating to the parking lot, as people do when they're socializing. And that sometimes goes to the late or early hours of the morning. And so I think little things like being able to remind folks of where they are spatially could potentially go a long way. And I'm really happy to hear that you've incorporated some design ideas in the structural change that's being proposed here. I guess for me, I'd love to hear a little bit about, and staff is on the call as well. And I do want to just indicate my appreciation for the staff of the feedback that we provided when this came to us last time, and the diligence and the work that's gone in. Devin, thanks if that was you. One of the things I noticed in the staff report on page 4, there's a table that provides details of license type with the hours established in the city of Courtenay. And it's indicated in the staff report that Ace Brewing has the manufacturer license through the liquor board, and that the manufacturing licenses in Courtenay the hours are currently 9 to midnight. Now, our proponent here today has asked for 9 to 1 a.m. And so I don't know if it's a question to staff or maybe to the proponent to speak to, but just wondering what the difference is here between what we're seeing in others who have this type of license in the community and what's being proposed.
Well, actually, when I saw that, what you're referring to, the manufacturers that actually had 0, 0, 0.
That's midnight.
Oh, was it? Okay.
That's midnight.
That's what it was. All right. All right. Now I understand. No, I didn't. So I wasn't sure. I was going to actually ask Devin about that, but I didn't have time to. But yeah, so no, I did. So I can't really reflect on that because I didn't know what that date that time was. But yeah, I didn't actually realize that was what
Part of the licensing.
Yeah, I didn't understand that. So I should have asked for clarification, but I wasn't sure if that was a different establishment or not. And obviously, like I said, I thought that was a typo. So I just, unfortunately, I can't really.
Just while you have the mic, you're not planning to change your license type. You're just reapplying under the same license, the manufacturing license.
Yeah, we're a manufacturer. Yeah. That's what we're under. Yeah. And one thing too, I did want to say as well, I did bring this up yesterday about the mail outs. It's unfortunate that the mail outs didn't include our letter of intent. I think it may have given a little bit more reasoning as to why we were wanting to have our hours change. And I think maybe it would have, I think maybe some of our neighbors would understand that a little bit more. So I don't know if maybe that would be something in the future that could possibly be put out with mail outs, because I do think it would have helped everyone understand at least somewhat of what we were trying to achieve.
Excellent. Appreciate that.
I'm just wondering, does staff have anything to speak to around the difference between the proponent and what we see across the city for those with the same license?
Mr. Garber?
Through the mayor to Councillor Jolicoeur, it's reporting back what was there. I had spoken to the applicant yesterday, and the original hours that were established for this was really to the original location of Ace Brewing, and they're looking for a change with respect to what the liquor licensing branch looks at for other manufacturers. They just deemed it to be appropriate at midnight, and we're responding to what the applicant has requested. We briefed council previously. We at a staff level, we don't really have any policy background to say 10, 11, 12, 1, 2, 4 a.m., 24 hours. We don't have any policy background to make a recommendation in that regard. So we're simply replying what other standards are out there.
Okay. Yeah. And to that point, and in speaking with staff, We have the substance use strategy phase 2 that will be coming to us. From my understanding, a bylaw, not a bylaw, but a policy recommendation around exactly what we're talking about today. And I appreciate that staff have done their due diligence and have indicated we don't have something to fall back on when applications like this come to us. And so when the substance use strategy comes, I just want to mention it to my colleagues here that would be something that I would be bringing forward as a resolution for staff to look into establishing a policy so that we know what to do when applications like this come forward, and we have a conversation around what we want our community to look like in terms of liquor sales. I guess for me, my final comment, and I'm glad that the proponent is here to share some context around what those hours could look like for her business. I really not a firm believer that good things happen serving alcohol at 1 a.m. And that's my personal opinion. I'll just say that. I do believe that patrons can enjoy themselves in facilities after liquor sales end. And as I said, your facility sells food and great food at that. And so I just want to speak to, and then I see others have, is that in the staff report, there is an option 2, which is not up on the screen, that speaks to aspects of the application. And I'm just going to share that is actually the option, the recommendation that I'll be looking for support for this.
Thanks very much. Next we have Councillor Moore.
Great, thank you, Mayor. Well, just a few things I noticed. Just in terms of the reports to the RCMP, there's been no enforceable complaints in the 6 years that you've been open. And to me, it's incongruent with the petition and also some of the letters that seem to be anticipating. Well, certainly some of them have said there's been a little bit of noise in parking lots and things like that. And actually, many of them say we like having a pub next door. So they're not, even the folks that are not necessarily in favor or are not, still like aspects of having that. So I guess I'm just wondering if staff or anybody has any information about, if in conversations with people on the petition or whatever, to me, they don't match because we have had no complaints. And I guess it kind of speaks to the bylaw process and the RCMP report process that I unfortunately, I lived in an area that was next to commercial businesses, which was good in many ways, but we did over the years have some really noisy neighbors, like way beyond. One of the worst was actually a fitness center, which is interesting. And we had great response. Like we called in, someone went and had a conversation and the problem went away. So we do have really good enforcement when there is an issue and good response. So I'm grappling with why people haven't called in if there's been concerns. And is this a case of anticipating something that maybe isn't, really a reality? And I guess I just wanted to ask, so a question to staff, but also if you've received any direct complaints from the neighbors.
We have had one lady in particular that's phoned in, but other than that, we haven't had any complaints. Yeah.
Okay.
And I met with that lady, but I'm going to pass it over to Mr. Garber.
Through the mayor to Councillor Moore, and thank you for the question. When I accompanied the mayor with a meeting with the applicant, a representative from the strata and a resident, and I asked that same question and stressed, and we actually share this with council all the time, whether it's RCMP related business. If there's an issue, make a complaint. And so the response, and I'm not here to speak for the individual, but what we heard was people didn't think that anything would happen or that. But I think that's why we always encourage the public, and you as councillors always encourage the public. If there's a concern, make a complaint, and then we'll work through it. And the discussion that we had, they shared that they had some concerns with an adjacent property. They worked with the property owner and they came to a solution. So that these are how the processes are to unfold. So it's unfortunate if people have experienced noise issues, and our bylaw staff are here to investigate that as our planning staff do the interpretation. So I just would continue to message. If you have a concern, please contact us.
Yeah.
And in the absence of that, that's why we have that statement in
Yeah.
the
And
in the
I
report.
think, you know, it's like any kind of sort of conflict resolution, you go to the person first. If you feel comfortable doing that, have a chat. If you don't get results, then you call either our CMP or bylaw, and there is a process. And I guess, you know, it is difficult. We get provided with the information, and if we don't have the information that clearly indicates that there's a problem with the issues that are outlined in the petition and the letters, then it's difficult because we don't really have any basis to make that determination that it is an issue. Thanks.
Yeah, and just to kind of reiterate, as we mentioned, actually our interim director of planning and myself met with a person last Wednesday, and that was the first time I was aware of petitions and the challenges, and immediately Rob actually said, "Hey, why don't we have a meeting?" And so we started planning to have the meeting that we had yesterday, because as what's been mentioned before, we're going to send basically a referral letter off, which may or may not be successful. But the challenge and the reason behind that petition isn't about the change in hours. It's actually about the current issues. And so that's why I think we found it incumbent to really try to build that community so we can find resolutions and compromises for everybody. With that, Councillor McCollum.
Yeah, thanks. I don't have a whole lot to add because I think we've had a great discussion around this. But yeah, I mean, kind of following up on the mayor's points, like some of the challenges for the neighbors is simply that they're across from commercially zoned properties. And with that does come some noise impacts, regardless of whether or not it's a patio or a gas station, which is next door. I mean, when you have a business with people coming and going and business being conducted, there are going to be noise associated with that. And when I met with one of the people that has some concerns around this, they did emphasize that it really was the noise of just, you know, people coming and going, and not so much that there was excessive noise that was associated with the consumption of alcohol, which is what we're considering today is a slight change to the license. So just from hearing that, I think there's some work to be done to make sure that we can best address what the concerns of the neighbors are, but I don't see that it needs to impact what we have here before us, and I'm comfortable supporting option one for that reason. I also want to add that I go to Ace Brewing somewhat regularly, not all the time, but I do go there, and I do notice that there are various routines that are done in order to mitigate, the blinds go down when it gets light or dark out to mitigate the light out the side of the building. And to me, it looks like you're going out of your way to be a good neighbor where you can. So I'm confident that you'll continue to do that, and that we can probably work with you and the neighbors to address some of the things that have come out of the neighborhood petition and some of the issues that have been raised. So yeah, happy to support your application. Thanks. Didn't we already move it? Oh, okay, I'll move it then. Just make sure I get the right one in front of me here. I'll move that council include their letter to the LCRB that the city of Courtenay has no objections to the application by Ace Brewing Company Limited for 1, a structural change, and 2, change in hours to their liquor license, and that the public comments be shared with the LCRB, and encourages the LCRB to consult with the local community and work with the applicant to address the public concerns should the LCRB decide to approve the application.
It's been moved and seconded, and I just want to thank Councillor McCollum for articulating some of those points in I think a pretty good way. Having met with multiple residents over the last week, one of the things is good communication. So hopefully we're on that path, regardless of the outcome of this discussion and and what the province ultimately who decides this. But two points that I would say that Councillor McCollum's comments reminded me of, having been on that temporary patio, the noises that I've heard, which are actually alluded to in the comments from the public, were actually coming from next door at the establishment that's adjacent. And that's been a longstanding place. Secondly, although I've never personally had any noise complaints from that complex regarding either of those establishments, I have had several phone calls over the years regarding the air park that's next door, and helicopters that are landing in the middle of the night. They tend to be paramedics, so it's a pretty easy conversation. But yeah, so people are reaching out. I think when the noises are exceptionally egregious. So with that, Councillor Schalker.
Yeah, I guess option 2 for me, it speaks to aspects of the application. And if it's not obvious from my comments earlier, I'm just a little concerned that we're setting up some potential challenging feedback if we're not abiding by, as a result of, and in the absence of a policy that the city might have around liquor establishments, around hours of operation. For example, we have the report from staff that indicate this license goes until midnight, not till 1 a.m. And so we are now considering sending our support that goes until 1 a.m. when in fact, what we're seeing from staff is that it currently goes until midnight. And so I guess my concern is that this might, although in the absence of a policy, it looks like we are perhaps moving away from practice. I'm just wondering if staff can speak to the risk of that from maybe our business community who might say, well, the manufacturing license that we've got approved goes until midnight, but you've approved one of our competitors until 1 a.m.
Mr. Garbutt.
Thank you through the mayor to Councillor Jolicoeur. We are in a political discussion here. In terms of the risk to the organization, there's no risk to the organization. The applicant has asked for a change, asked for the corporation to weigh in at a political level on the request, and it's ultimately up to a third party to approve or not approve. We anticipate with the growth and densification of areas, particularly with mixed use buildings, that we are going to be having interactions between residential properties and commercial properties of all kinds. The community plan envisions a very vibrant urban fabric, particularly downtown. Council has received feedback from some people about downtown, where we do extra work and beautification and cleaning in advance, about timing and everything. So each action we have has a reaction and consequence. But at this point, from a risk perspective, there isn't any risk to the organization. And these applications are dealt with on a case-by-case basis. There's often a discussion around precedents. And in this case, council has considered the material that's been provided to.
Thanks, Councillor Jolicoeur. And we have Councillor McCollum.
Thanks, Mayor. Yeah, I forgot to ask a question when I was speaking earlier, so I'll just pick it up now, seeing as we're still on the motion. In the letter that was submitted to council, there's some mention of a change to the inside licensing and a kitchen expansion, but it wasn't apparent to me in the report. Is it part of the same application, or is that going to be a subsequent piece?
As I just found out today was that it is going to be, we have to apply for a building permit. It's already to the liquor board. So it will be a building permit application for that expansion. It won't.
And that's an expansion on your manufacturing and kitchen space, but it doesn't impact the seating, and that's why it does impact the seating.
Oh, where is it? I don't know if I have the actual amount on here. It will a little bit. I don't know if you're familiar with the brewery, but a little bit of where the dartboards are, that's going to be pushed through, because we're going to take first section of Care Auto, so where their office is now, to the back of the building. So we're gonna move our kitchen into that area. We're gonna move my office, which is in the back in that area. And then we're gonna open up where the dartboards is, and we're gonna have a few tables in there, but the actual, I can't remember exactly what the actual amount is, but there will be a little bit of an addition. But with that as well, is we'll have more parking because our parking lot will then be pushed further down for where Care Auto is.
Okay, thanks for the explanation.
Excellent. Thanks for that. I see no mics, so I'm going to call the question. All those in favor? Any opposed? And that passes unanimously. That was a great discussion. Just want to thank the applicant for coming here to answer these questions and for meeting the residents. Do appreciate that.
Great. Thank you for having me.
All right. Yeah, thanks for turning the microphone off too. Excellent. All right, moving along. EV charging station. Sorry, Councillor Hillian.
Thanks, Mayor. I'll move that based on staff report, on the staff report, electric vehicle charging stations cost recovery model. Council directs staff to establish a full cost recovery flat rate fee model for all city-owned electric vehicle charging stations.
It's been moved and seconded, and so maybe we'll pass it over to staff if you'd like to speak to this. Kyle. Oh, sorry.
Thank you. Through the city manager to mayor and council, I'm pleased to present staff report electric vehicle charging station cost recovery model. This report presents two opportunities, one to talk about the cost recovery model, but also to announce that the stations are now complete and operational and in service. And we're excited that has actually finally come to fruition. It was a bit of a journey to get there, but we made it. So that's great. The city, in partnership with the Community Energy Association, received grant funding for the installation of 3 community charging stations. And they were made possible by the Clean BC's Community Grant Fund, which provided 73% of the total construction costs for these assets. Under the terms of the agreement between the Community Energy Association and the city now owns and must operate these units for a period of 5 years. The city is responsible to include the supply of electricity, as well as continuous public access for the assets through the duration of that time. Additionally, the city is responsible for the ongoing maintenance, associated operational costs, including power consumption, warranty, network fees, and other associated responses that may be required, whether it be snow and ice control or any deficiencies that might come to fruition through the use of. That said, the city is not, however, prohibited from recovering costs or that have been incurred relative to the operation or maintenance of these facilities. And that can be either established through a fee-based recovery model that's either subsidized, partially subsidized, or revenue neutral. Table 2 within the staff report provides a summary of all associated costs relative to this new service. I'll preface that the assumptions were made based on a median usage of these facilities, that being an average of 6 hours per day for each of one of the ports. There is a total of 5 ports available within the 3 stations. And that equated to an annual operating cost of around $33,000 per year. So with that, I'm happy to take any questions that council may have.
Thanks so much. The lights are blinking. Councillor Moran.
Thank you. Yeah, I mean, we've had a few comments come in wondering if we're going to be charging folks who I guess are not in favor of electric vehicles or something. Yeah, anyway, I guess I'm curious. I know it's really early days, but do we have a sense of how much usage they're getting currently? Or do we have a mechanism to track that, or what's the usage? Thanks.
Yeah, it's a great question. Thank you for that. Through the city manager to Councillor Warren. The systems themselves have a tracking metric that provide us with an output of actual usage and actual consumption power. So not every appurtenance that's attached to that EV station draws the exact amount. So we'll have really good real-time data that we can report back to in terms of a metric consumption. I'll offer that currently through the stations being free, that they're fairly well consumed. When people are arriving at particular assets or within the downtown core or the city hall for that matter. So, but yeah, we'll be able to report back on a fairly regular basis if council so chooses.
Thanks for that. And Councillor McCollum.
Thanks. Yeah, no, I am happy with the recommendation and I think going with the cost recovery model is really the only method that makes sense given the times that we're in and yeah, the adoption of electric vehicles, especially in BC. Apparently we're a leader in North America in terms of EV sales. So having options for people to charge wherever they go is an important part of that transition, but it doesn't mean it should be subsidized. I also think that we don't want to see municipalities undercut private business that are wanting to get into this market as well. That we want it, you know, as much of this infrastructure to be existing in communities. So I don't really see an argument for delivering it for free. But I am hesitant to support the $3 an hour figure for a couple of reasons. One, I'm not sure if I could come up with a similar number for the cost of power. My estimate was like 40 to 60 or 40 to 70 cents an hour. So what are we assuming the cost of power in this report? I assume that we pay like somewhere around level 2 or the second level in hydro, I think is 12 cents a kilowatt hour.
Yeah, fair. It's so it is based on the rate in which is established by the asset in which the facility is located. So at the Lewis Center, for instance, as a commercial business, the rate in which we've attached it to there, as well as the City Hall. The lesser rate would be that of the one at the I think it's closer to the 4 to 6 cents an hour at the Herbaloo site because of the consumption capacity that exists at that particular location. It's a variable rate that's based on consumption, based on kilowatt usage. It's one that we've estimated out through consultation with our facilities manager based on our historical average, but it's definitely something that is variable in terms of the actual cost associated. It's a fairly good number that we feel fairly confident standing on based on the consumption per unit, and that's per port. So each port, given that the stations themselves have either 2 ports or 1 port, the power consumption could vary relatively based on total usage of those. But it is something that we could look at in terms of recovering and then looking back at on a per annual basis as it'll be included within our fees and charges model. But it's something we want to look at on an annual basis to ensure that it's accurate relative to the usage and the expense.
Yeah, because I assume 12 cents a kilowatt hour, but that's just the high rate on my residential bill. I actually have no idea what it is commercially or for a municipality. So I wasn't sure what to build that on. But just based on this, I think we're looking at maybe 50 cents to $1 per kilowatt hour. And the BC Hydro level 3 chargers are doing about 30 cents a kilowatt hour. So I guess my concern is that if we're delivering charging at, you know, a 10th the speed as the level 3 chargers, but we're charging, you know, double the price, that we're not going to be able to recover our costs because the public will realize that that's not the best place to connect. So, I mean, we do have to kind of look at what the market is. So in my mind, I would prefer that we aim for more like the $2 and not provide any charging for free, as some of the comparatives were in the chart that it's a straight $2 an hour. But I think if we're pushing up at that $3 an hour, that, you know, you get, I mean, full disclosure, I just got an EV, so I've charged around town, and you do get quite a bit of information from your vehicle about how much power you're receiving and at what speed. So it doesn't take a lot of experience to realize that you're better off to go down to the level 3 charger, spend 20 minutes there, and then, you know, we're not achieving our goals with those chargers. So I just wanted to express that.
All right, thanks, Councillor McCollum. Councillor Jolicoeur.
I just learned a lot. Thank you for that, Councillor McCollum. I guess my question is around in the staff report, you speak to what the cost recovery would cover. And not that I want to presume that this will happen, but it speaks to ongoing maintenance. But how do we have a reserve if there's major damage if an aspect of the asset is beyond just a regular maintenance, but needs to be actually replaced. Where does that come from, or are we planning for that? And I guess just while I have the mic, my second question is related to, again, I guess the protection of our assets and asset management. Are the assets being covered by any kind of security system?
It's great questions. Thank you for those. To answer your first question about damage or maintenance. So currently there's nothing in the operational budget to support it. So it'd be a variance that would exist within the transportation group. There's funding that's been set aside within the fee model at 38 cents per kilowatt hour that would be attributed to that funding source and that recovery model over the long term. So if there wasn't 38 cents that was attributed, that would come out of the operational budget to support any of those repairs or maintenance activities that would result. From a tangible asset perspective, in terms of security of it, it is at a public facility. For the most part, there's no cameras or anything that in particular at this time that are protecting those assets in that way.
If I may,
Mr. Garvin.
Thank you, and thank you for the questions, Council. We're really excited to be in this game. I happen to have my first weekend of a fully electric vehicle. We're really trying to come forward, and we would take Council's direction on the rate. I really appreciate that what we've heard so far is supportive of charging a rate. I can report in my 3 days of attempting to drive a fully electric vehicle, 5 stations I attended. 3 of them were inoperable because they'd been damaged and available. And if any of you have driven to the West Coast and stopped at the T of Euclid and Tofino, it's almost impossible to charge there because the cords go missing. So we are anticipating that there will be some maintenance costs, and we will report back on that. I just wanted to offer that because the model that the Community Energy Association decided to move forward with is not componentized. I'm going to quote from my public works colleague. So it may very well be, if we have vandalism or damage, that we do have some very significant costs and or the ability to access replacement parts. And so I spoke with Mr. Jerslet, whose responsibility was to lead this initiative. And so we are very much excited, because they're very well used. That just right out my window at City Hall, it's used all day long, every day. That we are a little nervous about what the operational costs will be, and that's why we came forward with the rate as proposed. And I think it would be really important for us to use the monitoring mechanisms that are built into the charge point system, and come back to staff, to council, and with a really robust report on use and those costs. We do know with the downtown Urban Loop facility, there has been significant costs related to vandalism, et cetera. We're hopeful, because of the community good related to that we weren't going to have those costs. Likewise with this, it's a big picture aspiration, both of the community and our own organization. And so I just offer that the unknown right now, we have an opportunity to set a rate, and then we could be flexible as well. So I think that would be important. At whatever rate that council gives us direction on, it's important for us to report back, and we may have to adjust it.
Yeah. Councillor, let me just make sure I got the right number here. Councillor Gilliker.
Yeah, just as a follow-up to my question around security, and that's really helpful comments from our city manager. Just with a risk hat on, if we're, really trying to encourage people, this will be added to the map of charging stations in the community. Hopefully people will be relying on this as a reliable source of charging their vehicles. Is there an opportunity for us to explore? I'm thinking at least at the Lewis Center and at City Hall, where there are buildings, for us to have security footage, so that if it might even be a when vandalism occurs or major damage occurs beyond what is projected under generally accepted maintenance costs, that there is some sort of mechanism for us to recoup that through video footage and and proceeding with a criminal perhaps charge, or seeking some support from policing. So just an idea, if they're co-located on facilities that do have, electrical hookup. Just an idea to mitigate some of those risks.
Mr. Garbutt.
At a staff level, thank you through the mayor to Councilor Jolicoeur. At a staff level, we're just going to work on, because there are some privacy issues related to video surveillance. And we'll come back to council at a point to be determined about that, because some of those vandalism issues are happening at facilities, and stay tuned for information on that. But it's important from as the local government that we're totally in compliance with our freedom of information, protection of privacy requirements, and then we balance that with real cost dollars of having these impacts. Yeah, thanks.
So thanks for that. Councillor McCollum.
Yeah, to follow up on that, I mean, I hope this isn't something that we have to address on a regular basis, but I do know that there was level 3 charging at Buckley Bay, and it was taken out because of continual theft. But I think those type of chargers have a lot more copper in the wires, so they tend to be targeted more so than these type of chargers that we've installed. So hopefully we won't be discussing this a whole heck of a lot. But yeah, it may impact future locations based on security. It does help that they're completely visible and in well-used areas around town. So, and I haven't heard of any of these smaller stations being damaged yet around our community. So maybe it won't be a big challenge. But yeah, just to, I don't know, circle back to what I brought up earlier, that I would be in support of a $2 an hour fee, and yeah, maybe making a point of bringing that back after we have some data and just looking at usage and whether or not that's meeting our cost recovery goals. Because I would be open to a higher amount, but I don't want to create a problem of people not using this great infrastructure that we've waited so long to provide. So thanks.
Thanks, Councillor McCollum. And excellent. I think we've had a very fulsome discussion, but I'm going to pass it back to Kyle.
Yeah, thank you for that. Just quickly, while I still have it on top of mind in terms of security patrols, obviously we still have contract services through security patrols, and they offer fortnightly visits to all of our facilities, including the downtown Urban. So that is still a part. That's a roaming type of review, and so it's not in any one particular time. So there is that additional piece. I'll also offer that we, like our other municipal partners, are just starting this process. We're getting into the game of EV chargers, and so they're all learning with us. Part of the development of this was to reach out to those communities to understand what their fee structure models would look like, and they're all in the same boat as us in terms of understanding what it is, what the net impact is going to be, and what the cost recovery will be long term. And so we're all going to continue to share that information so that we can create consistency in terms of the delivery of these services across the valley.
Excellent. Thanks for that. We have a motion on the floor, so I'm going to call the question. All those in favor? That's unanimous. And we'll move on to the Town of Comox request for a letter of support. Councillor Warren.
Thanks, Mayor. I'll move that council direct staff to provide a letter of support to the Town of Comox regarding updated Comox Airport zoning regulations.
Mr. Mayor, it's been moved and seconded. Mr. Garbutt.
Thank you, Mayor and Council. We appreciate this request from the Town of Comox. Council is aware that at a staff level, we've been working with Crown Isle and the Department of National Defense on height restrictions that affect a relatively small portion of the city, but it directly impacts Crown Isle and their ability to densify in accordance and consistent with their community plan. So we were happy to draft this for council's endorsement. And but I just want to let you know that Mr. Roycroft and I are going to be on a call tomorrow morning with D&D to talk about a comprehensive approach for Crown Isle. Crown Isle has done a lot of work to map the flight protection and provide building typology, and has been a great partner because the reason why the AZR is the acronym for the airport zoning regulations. The reason why the federal government is interested in these things is that their primary concern is safety and ensuring that from a land use perspective, there's both obstructions are regulated, but on the private development side, things like colors, reflective surfaces, bird attractants, the other things that are safety issues, there's a great opportunity for partnership. So we're starting this, we're working really closely in this case of the developer. And then it's my understanding that at a staff level, the two municipalities will be also working directly with D&D. And the idea is to actually develop a process to accommodate both the update of the AZR, which has been in place for an extremely long time, but also a way to look at interim steps to have exemptions to this height. And right now, there really isn't a clear process, and that process would involve, developers. They always ask us for clear processes, and the federal government has been wonderful in wanting to put something together that is really responsive and gives a level or consistent approach to considering these regulations. So just wanted to let you know that we're making good progress in that regard.
All right, thanks for that. And any questions or comments? Seeing none, all those in favor? Any opposed? That passes unanimously. On to 7.1 Heritage Advisory Commission minutes. Excellent. It's been moved and seconded. There is a recommendation. Sorry if somebody wants to move the recommendation. Oh. Yeah, I'll get there yet. Any questions or comments? See none. All those in favor? Any opposed? That passes unanimously. And the next one is the annual report. Okay, it's been moved and seconded. Any questions on the annual report? Seeing none. All those in favor? Any opposed? That passes unanimously. And now we are into council reports. I just want to acknowledge that Councillor Cole Hamilton is attending FCM meetings on behalf of the municipality right now, and just want to thank him for the efforts that he's doing. And I have Councillor Hillian.
Thanks, Mayor. Two things I'd like to share. I continue to have conversations with numerous people around town, residents with concerns related to challenges that we're experiencing. We refer them to them as urban issues, and essentially they involve services that are being provided that result in people congregating in areas along 5th Street downtown. Side effects of that that residents are experiencing, as well as businesses. And in relation to that, it's my intent to bring forward a proposal at a future council meeting that the city work with the Downtown Business Association and our community agencies to conduct a major spring cleanup event. I think it's important that we do something tangible to address some of the concerns that people downtown have. And I actually attended, along with Councillor Moran, at the library on Friday lunchtime, the meeting that Coalition to End Homelessness convenes with people with lived experiences. And very interestingly, one of the topics that came up by one of the individuals there and generated a fair amount of discussion, and these were his words: the town looks a mess. We should do something about it. And so I think we've got common ground between people who live in the community and those who operate businesses. On that subject, very pleased that our bylaw department has been able to gain compliance in some cleanup activities related to the Kona Hospital. My thanks for that, and I hope we can carry on with the efforts to sort those challenges out. Second thing I'd like to acknowledge is that there have been, and it being International Women's Day, this is something that's very close to my heart. We know that the role of women in society continues to be underrepresented, and there continue to be issues that adversely affect women more so than men. We know that, for example, during the pandemic, rates of domestic violence increased. And we know that on days like Super Bowl and other events like that, the same thing happens. So, of course, people are justifiably concerned about that. While as council members, we are unable to speak to specific situations that may arise from time to time, people in the community should have no doubt that where we stand in relation to this issue. For myself, I'm a founding director of the Comox Valley Transition Society, which is available to support people in these situations and does tremendous work in our community on a number of fronts, primarily in providing refuge for women from and children who are experiencing these types of situations. And certainly that organization is available to anyone who needs their support. But in the meantime, I think I speak for all my council colleagues in saying that we certainly deplore the victimization of anyone, in particular in intimate partner situations, and obviously stand with people who are providing services and supporting those situations. And I think it's just really important that as a member of council, and I'm sure my colleagues would agree that we make ourselves clear on that point. And so that's basically what I wanted to say tonight, in acknowledging that the 8th of March is International Women's Day, and it should be more than just slogans and platitudes. It should be a commitment to real action to make these situations better for all of our citizens. Thank you.
Thanks so much, Councillor Hillian, for those words. Really heartfelt, and I totally concur. Councillor Gilles.
Yeah, and just to voice my support, and thanks, Councillor Hillian, for speaking to that. Over the last 2 weeks, Councillor Hillian mentioned meeting with multiple residences and business owners in the community around our urban issues. That's something that I've been spending a lot of time doing as well. So I just want to say thank you to those who've been willing to meet to express their concerns around the issues that we're all experiencing in our community. Similar to meeting with individuals who are directly impacted, whether they're business owners or their residents in specific neighborhoods. The substance use strategy had its monthly meeting where we really discussed our phase 2 report being launched. We also met with some Island Health representatives around getting some of that institutional buy-in around supporting the actions related to phase 1 and phase 2, and exploring the way in which we are going to roll out the collaborative, which will be, as it sounds, a collaborative group of decision makers who can allocate resources and funding to address the issues related to all substance use in the community. And so that's going to be coming and being launched in the next few months. The Coalition to End Homelessness also had their monthly meeting where we got to discuss the increase in funding from the CVRD. So thank you to my colleagues around the table for supporting that. And that's going to be going directly to supporting housing initiatives that support affordable housing in the community, and housing that's specific to demographics that are often overlooked, the LGBTQ community, youth, and seniors specifically. And so just want to share my appreciation to the CVRD board for approving that, and for the Coalition in leading that work on the ground. And I think the other thing that I'll mention is that over the last 2 weeks, again, on the issue of urban issues, we had a meeting with our MLA, which the mayor alluded to. Every time we speak with other levels of government, since our last council meeting, we did get to meet with our MLA as well with the RCMP, where a large focus of those conversations were specifically to address ways in which we can continue to collaborate in addressing some of these issues. And as I said, a lot of community groups are working on this, and it has been alluded to, there will be a town hall specifically on this for businesses in the community. And so I did want to just relate this to the public, that, you know, this is something that is taking up much of our time, and we all agree that this is an urgent issue, and we're spending time listening, and we're spending time moving towards solutions together. And so I just want to appreciate everyone who's been open to meeting with us, as well as the receptivity from our partners in the nonprofit sector, as well as our MLA and the RCMP. Thank you.
Thanks, Councillor Gilles and Councillor Cullen.
Thanks, Mayor. Yeah, a couple short updates. one update I have is just as my role on the rec commission as chair. We had a lengthy capital planning workshop of the Recreation Commission Board at the CVRD to talk about investments around our aquatic services, an artificial turf surface and another ice surface. And yeah, we had some really great discussion. I think at the end of the day, for the most part, staff came away with some fairly clear direction from the board. Although one item that we were completely divided on was the ideal location for an artificial turf. Although I think it was fairly clear that there's interest across the board for an artificial turf surface, but the best location still remains to be determined. And next steps will be for the regional district staff to go back out to their municipal colleagues and just get some more input before we put further study into those options, and maybe we'll be able to narrow it down to 2 sites from the 3 that we're kind of debating right now. So yeah, that's all I wanted to say on the capital planning. And then the other item was that I attended an early years collaborative planning session, and the work of the city and how to support childcare in our community is a big topic at these meetings, and just that they're very keen to look at ways to support the city and our policies around getting more childcare spaces into our facilities and supporting nonprofits. And yeah, and also just wanted to recognize that Councillor Moran filled in for me at an earlier meeting and was working with the group to maybe bring something to AVICC, but there's not a really clear direction on what the best approach for that to be. Just understanding how long the process is from the time that we would draft a resolution here to when it makes its way to UBCM, that the scope needs to be pretty broad, that they're going to take some time and consider that, and we'll look at it for next year. So just wanted to provide those updates. Thanks.
Thanks so much, Councillor McCullum and Councillor Moran.
Great, thank you, Mayor. I'll try to be quick here. Just wanted to report on, we had our very first Regional Parks Committee meeting through the CVRD. This is the brand new service that the past board introduced, and we are embarking on strategic planning, and there will be some consultants involved in taking a look at, with lots of public engagement around what that service is going to look like. And the budget is fairly low at this point. Not looking at acquiring big chunks of land yet, but it's really exciting. There's so many of us that have been hoping for something like this to protect our natural spaces and provide some other benefits to the community. Director Arbor was elected chair and I was elected vice chair. I don't think there was an election, but anyway, I'm vice chair. So excited about that. And as Councillor Hillian mentioned, we went to the meeting at the library with folks who are experiencing homelessness, and I thought a really great group of folks who were very engaged for the most part, and came up with some ideas, and definitely I think are aligned with us in terms of wanting to have a healthy, safe community. So that was encouraging. You always wish that was the message that got out there, that there's a few folks in the minority that cause problems, but most people have the same kind of goals that the rest of us have. We had a social planning equity policy workshop, which many local government people attended, just to look at how we can build equity policy into the work that we do. I went to a community action team meeting. Director Jolicoeur is the representative, but I've been going to those meetings for a long time. So I pop in every now and then, and because it is an interest of mine, and once again, the numbers of toxic deaths are up. And I just think it's important for us to acknowledge that. And, I don't always share personal information at council meetings, but I think it is good to keep it real that my extended family had 3 deaths in the last 3 weeks. Don't want to go into too many details. They weren't all in Courtenay, but a mother, her son, and also a mom. So it's extremely personal to me in my life, and I think it just really indicates that this impacts everyone. And 3 deaths in a week or so was a lot. I was mostly supporting the other folks with that grief. But it hits hard. So just wanted to mention that and hope that we can just continue to advocate to the powers that be for the services that we need. Thank you.
Thanks so much, Councillor Morton. Appreciate your report. And I think one of the things it highlights is even if you are acclaimed, there was an election that happened, and our council members, I believe, do have great leadership positions at the regional district. And I just want to thank our regional district, well, most of our council members who are there and are providing that leadership. It is much appreciated. Sorry, did I misspeak?
No, I just wanted to clarify when I said a mother and son, it was an adult son. So it wasn't a situation where it was a young person. I just wanted to make that clear. Thanks. Might have been a bit misleading. Thank you.
No, totally understandable. Thanks for that. So if I look over the past couple of weeks, there are a couple of big events that happened, and I'm just going to assume most of council were involved. Coldest Net of the Year, which has raised up $184,000 so far. That's 92% of the goal for if you're listening to this. Let's get on it. We have the end of the month to raise some more funds for it. And, Dawn to Dawn is one of the organizations that benefits, that deals with the unhoused, but also the Comox Valley Transition Society, which Councillor Hillian spoke about earlier, and really the importance about supporting organizations like the Transition Society that are working with women and children who are fleeing violence in the home. And I think that's absolutely a critical need in our community. Also, there's the Yana Big Love dinner, and that dollar amount was just announced today, $205,000. I believe that is a record. I've been working with Yana for about 15 years, and again, just another amazing organization in our community, working really focused on children that have to go for medical treatments outside of the Comox Valley, and obviously mothers or expectant mothers that may have to go to other centers. And personally, I'm part of a Yana family because of our twins that were born out of town. The Adaptive Snow Sports Awareness Day happened up at Mount Washington. And again, a great volunteer-run organization with Mount Washington. And there was also a Pride event up at Mount Washington. And I've actually seen pictures of Councillor Jolicoeur, so I'm going to give him far more credit than mine. I was unfortunately instructing up there. So although had I been thinking about it, I'm sure I would have dressed up a little bit more. Really want to acknowledge the meetings that we've been having, again, just in the past couple of weeks. And this has pretty much been going on since the beginning of the term and even before that. But meeting with the RCMP, meeting with our MLA, meeting with the downtown BIA. We're organizing that safety and security meeting that's going to be happening for business owners, the Coalition to End Homelessness. I've been meeting with business owners, homeowners, with the Junction Community Advisory Group. And, all those types of meetings are really informing. I think a lot of the discussion around the table, and in particular tonight, that discussion may have been a little bit more than it has been in the past, but I think it really is. I think Councillor Jolicoeur talked about, this is kind of democracy in accessing your elected officials. I also chaired the Regional Island Coastal Economic Trust meeting, which has been going for about 15 years. However, been doing great work, such as our parklet on 4th Street, but really needs to be recapitalized. And I've been working with the executive to make sure that that happens through the province. Attended a social equity lens workshop, which I believe others here attended. So I just want to acknowledge that it wasn't just me, but again, just want to appreciate that event that happened. And then finally, again, International Women's Day, which was, there was an event today at 40 Knots. And I just really want to acknowledge and really comment. One of the speakers said that, really a call to action, that it's up to not just women, but it's up to men as well to stand up for women's equality. So, and again, just want to thank everybody for that event today. And I think that's probably more than enough. So with that, I see Councillor Morin as well. So I'll pass it over to you.
Great. For moving on, I'd like to move that Council authorize Councillor Doug Hillian to attend the High Ground 2023 Columbia Institute Conference, March 24th and 25th, and that the associated costs be covered through the council budget.
It's been moved and seconded. Any questions or comments? All those in favor? Any opposed? That passes unanimously, and there's a notice of motion. Are we going to read the notice of motion? I appreciate you thinking about keeping our meeting as brief as possible. And I think that ship has sailed this evening. So
this is my notice of motion, as alluded to earlier in the meeting. The province has recently moved forward with their budget 2023. And so this is in response to that. The motion is titled Equitable Access to Mental Health and Substance Use Services in Comox Valley. Whereas the BC government has committed to utilize surplus and additional funding in budget 2023 for mental health and substance use service. And whereas the Comox Valley currently lacks the continuum of mental health and substance use services locally, including medical detox, inhalation overdose prevention services, mental health treatment facilities, managed alcohol programs, Indigenous healing services, substance use treatment facilities, and second stage housing. Therefore, be it resolved that the City of Courtenay advocate to the Premier, Ministers of Health and Mental Health and Addiction to increase funding to Island Health, local nonprofits and private providers for the purpose of filling the gap in mental health and substance use services in the Comox Valley. And be it resolved further that the city write to regional local government partners to seek their interest in submitting a shared regional letter to the BC government.
Thanks so much, Councillor Jolicoeur, for that notice of motion. And we're going to move into bylaws. Councillor Morin.
I'll move that council rescind third reading, give new third reading as amended, and adopt zoning amendment bylaw number 3017-2023, which is 801 Ryan Road. Thanks.
Okay, it's been moved and seconded. Mr. Garbutt.
Thank you, Mayor and Council. Given the some of the changes that had to happen in from a practical perspective relative to this application, the bylaw has been amended slightly. We're happy to be bringing back a bylaw that has received support on covenants. Council may recall that the housing agreement, which addressed council's requests and municipalities' requests on affordable housing, was brought forward previously. We were in quite an extended waiting period to take forward and get approved the required covenant releases. You may recall that those were third-party covenants on the use of the property. We're happy to report that those have now been addressed. The applicant has notified of us, and staff have confirmed. The staff report itself is fairly comprehensive. If council has any questions, Mr. Grimsmith is on the line to answer any questions you may have.
All right, thanks so much for that. Councillor Jolicoeur. There are slides, so we're going to pass it over to you, Mike.
Hey, thank you. Can you hear me okay?
Yeah, you're coming through loud and clear.
Great. So through the chair, 801 Ryan Road is a vacant lot adjacent to Superstore on land designated as town center in the official community plan. Town centers are meant to attract some of the highest densities of development in the city, including multi-residential. The lot is currently zoned commercial 1A, and the applicant wishes to rezone to a comprehensive development zone for 3 buildings with 247 rental apartment units, including 25 secured affordable housing units. This would also extend Tunner Drive and build a multi-use path from Hunt Road into the development on city and private property, with the private portion dedicated to the city. The multi-use path provides a key link in cycling and pedestrian networks as shown in the parks and cycling master plans. Next slide, please. This file was first before council in September 2021 when council passed a motion to postpone consideration. Council gave first and second readings October 2021 after the applicant proposed price fixed rental units and updated plans showing additional open space. Public hearing was also in October and third reading passed November 2021. A housing agreement bylaw was adopted June 2022, detailing the 25 affordable rental housing unit requirement. It became clear that some changes were needed when finalizing other covenant details. First, a site access from Ryan Road through the neighboring BC Housing and Mex Pub properties private access was going to be secured after rezoning, but has instead been secured through a condition in the development covenant the owner signed. Next slide, please. Another change since this was last brought to council is the proposed short right turn lane / bus stop on Ryan Road. You can see on the far left was found to be unworkable and is being replaced by conditions to facilitate future Ryan Road widening for bus lanes. A 3-meter wide no build area along the entire frontage of Ryan Road with an 80-year option to purchase for $1. Although improvements would not be immediate, this proposal is workable, a better long-term fit, and supported by the Ministry of Transportation, BC Transit, the applicant, and city staff. There's also an administrative change to the zone. The Tunner Drive dedication, you can see on the far right there, was discussed in previous reports to council, but wasn't incorporated in the draft zone's minimum lot size requirement. The file needs a new third reading because the draft bylaw needs updated specifications for lot size and for the ratio of floor area to lot size to acknowledge that the lot will become smaller after Tunner Drive road dedication. The building sizes are unchanged from the previous reports to council, so actual density is not changed. This is a minor administrative change that ensures that the development can proceed as planned without becoming non-compliant after the dedication. As this is a comprehensive development zone that is tailored to the site, this administrative change does not impact other properties. With that, I welcome any questions.
Fantastic. Thanks so much for that. And Councillor McCollum.
Yeah, just a small question about the option to acquire the frontage for a bus lane. Is it only for that purpose, or could it be for other uses like extended sidewalk or bike lane or other uses?
If you give me just a moment, I'll pull up the covenant. It's intended for road widening and for that purpose, but I can look at the exact language if you like and get back to you.
Yeah, I just, if it's for any type of road use, then that does answer my question, so.
Mr. Garvin,
yeah.
you want to?
That's through the mayor, thanks. It is for that purpose, and council is aware through our cycling network plan and discussions we've had with respect to the transit, the transit infrastructure prioritization that we'd be looking through to work with this corridor. We're also looking at signal prioritization, et cetera.
Mm-hmm. Excellent. Thanks for that clarification. Councillor Gilles.
Yeah, thank you. And thank you for to staff for attaching the previous, as I'm the newer member of council, so I didn't see this at first and second reading, and for staff for spending some time with me on this application to really understand it. I shared some of my questions with staff, but I'll just share it again. And I am curious, in the housing agreement, my questions are not so much around the zoning, but more around the housing agreement. And I appreciate that staff actually pulled up the amount of 1 bedroom, 2 bedroom, 3 bedrooms. Do we have any idea from the proponent what the 25 affordable housing units are? My second question around the affordable units is there is in the staff report from 2021 calculation. And so just wondering again, if those are in fact the accurate calculations that have been included in the housing agreement. And I just will note that, my basic math skills calculate this at just under 10% of the total units. And I know that is not necessarily reflective in our new OCP. So I do just get curious if there is any way, and this is a question to staff, for us to explore with the proponent increasing the total amount of affordable housing units to be more aligned with our current OCP.
Mr. Garvey.
Thank you, through council. Thank you, Councillor Joel Kern. I appreciate the opportunity to work with you a bit on this historical application. I believe the applicant is here if they want to provide some information. I will say what's in front of council was what council requested of the day. The application was referred back. We worked closely with the applicant to address that. We acknowledge that the community plan policies have changed. We're coming to the end of applications that were underway prior to the option. Well, I shouldn't say coming to the end. There are a few more applications and we've had different developers respond differently to the changed circumstance with the OCP. I would note that, the readings on this bylaw were a very long time ago prior to that. And I would acknowledge that the applicant worked closely with the staff of the day to respond to council's stated concerns. Thank you to Mr. Grimswood, who has taken this application forward. The staff that worked on this originally are no longer with the municipality. With respect to requests for some additionality, at this point, we have bylaws and a housing agreement that are in place. So that it's not really a matter for us as staff to comment on, and we look to council to respond to the recommendation that we have. Now, I'm sure if the applicant wants to speak to any of that.
Thank you, Mayor Wells and member council. My name is Trevor Dickey and I'm the vice president with Broad Street. I may have my colleague Rachel Ricard on the phone as well. But I cover about 47 projects from here to Ottawa and about 6,000 units. So I might have a minutiae of everything. But with respect to the affordable, I think at the time said it was the policy of the day, and we had gone over and above the policy of the day at that time to provide 10%. There was a cash payment at that time that was significantly less. So at the time we'd gone over and above what the request was or the policy was. All the agreements are signed. We're at the 1 yard line or the half yard line. So I think that from our perspective, we had worked through with staff and council at the time and had established that. With respect to the unit mix, we're still working that out. Will be a combination of 1 bedroom and 2 bedroom. But things this time, I think just based on the units, I think of the 25, it'd be 15 1 beds and 10 2 beds, subject to some adjustments as we go through with the final layouts.
All right. Thanks for that answer. And Councillor Hillman.
Thanks, Mayor. I don't have any questions for you, Mr. Dickey, but I certainly appreciate your patience in sticking with us through all the other business that we've conducted before getting to this tonight. Thank you.
You are very thorough. So
what I did want to say is a couple of things. First of all, thanks to staff for the graphics, which I think are very helpful. And you know, it looks like a good development. I know we've been waiting for this for some time and I've had a number of people ask me if it's still going ahead. So I'm pleased to see it come forward tonight. I'm pleased to see the what has been done to work out the different arrangements. And staff and council colleagues will know that it's certainly my bias that these sorts of arrangements for housing covenants and other things be sorted out at the staff level rather than negotiated on the council floor at a meeting. So I just want to support the recommendation that's been brought forward, and I look forward to this providing more housing in our community. Thanks.
Thanks, Councillor Hillian and Councillor Moore.
Great, thanks, Mayor. So the number of 3-bedroom units is as indicated, or because I'm just really happy to see 3-bedroom. I mean, we certainly need units across the board, but it has been a while since we talked about it. So I'm just, yeah, I know that we've been getting some feedback on.
Yeah, that mix is current. Typically, this is what we do across our system. We typically do this same proportionate, and we find, you know, the 2-bed, 2-bath is typically the most affordable units because we do a 2-bed with 2-bath, so you can get a roommate and live quite comfortably with another person. So we find that, you know, it appeals to a broad range of the market and does allow for that probably the best level of affordability when you can have a proper shared accommodation with your own bathroom.
Yeah, no, I am really happy to see that configuration. Thank you.
Thanks, and Councillor Hillian.
I actually do have a question for Mr. Dickey that I'm hopeful he can respond to. You mentioned that you cover a lot of ground across the country dealing with all sorts of properties. And so presumably this type of proposal, you're building this type of housing all over the place. I'm just wondering what you're seeing in terms of municipal requirements for affordable housing as you build these developments.
Well, it varies across the board. We're in 5 provinces from here to Ottawa, 32 or 36 municipalities. We have 15,000 units right now, and we build about 2,000 a year. So, you know, I think it's safe to say there's no sort of single formula that we deal with. It's basically on a case-by-case basis. I think, you know, probably a 10% allocation is probably amongst the highest we see across the system. I don't think, I know there's some movement to look at upping that a bit. But I would say that a 10% allocation in terms of dedicating units is probably one of the highest criteria that we've come across in the projects we've done to date.
Excellent.
Thanks very much.
If I may, I'm getting a look from my colleague acting for, we need to just remain, we're post public hearing. If our Mr. Dickey wants to ask some questions after you deal with the matter, that'd be wonderful. It brings a great deal of expertise from across Canada, so I'd honor his experience. But if council wants to stay on the matter at hand, that would make my colleague to my far right more happy.
I don't know what's in the water tonight, but we are certainly chatty to be fair. And but I just want to acknowledge though that that you know, this is a sorely needed development. We're looking for getting as much units built in our community as possible. We certainly can't build them fast enough, but really to acknowledge that this developer was working with council for, again, things that were brought up at the last minute. So you know, the what we have in here certainly might not meet our current OCP, but it was light years ahead of our previous policy. So I do just want to thank.
Yeah, and if I without getting myself into the problem side, just like to say this application was extremely complex. Probably one of the most complex ones we dealt with all the moving parts. And I appreciate certainly Mr. Grimsrud and Mr. Roycroft, their help in getting this. The last 2 miles was the hardest, and I think we're there. And we will be getting to it immediately, and so we'll be under construction, and we can build things fairly quickly. So I'm hoping within 12 or 14 months we'll be ready to cut a ribbon. So thank you, Mayor and Council.
All right, thanks for that. All right, we've had a lengthy discussion. All those in favor? Any opposed? That passes unanimously. And we'll move on to the fees and charges amendment bylaw. If somebody would like to move that, and we have Councillor Morin.
Great. I'll move that council adopt City of Courtney fees and charges amendment bylaw number 3087, 2023, which is the solid waste collection fees.
It's been moved and seconded. Are there any questions or comments? Seeing none, all those in favor, any opposed, that passes unanimously. And fees and charges amendment bylaw 3088, 2023. Councillor Moran.
I didn't see any other lights, so that I move that council adopt City of Courtney fees and charges amendment bylaw number 3088, 2023, the sanitary sewer system.
It's been moved and seconded. Any questions or comments regarding this? Seeing none, all those in favor, that passes unanimously. And moving into charges amendment bylaw 3089, 2023. Oh, we have Councillor Hillian.
Thanks, Mayor. I move that council adopt City of Courtney fees and charges amendment bylaw number 3089, 2023 water distribution system.
It's been seconded, and I do have a question here. Oh, maybe I don't. Okay. See no questions. All those in favor? Any opposed? And that passes unanimously. And finally, we have bylaw 3090, 2023, and Councillor Jolicoeur.
Just excited to get us moving through this agenda. The council adopt the City of Courtney fees and charges amendment bylaw number 3090, 2023, the storm sewer system.
Okay, it's been moved and seconded. Any questions or comments? Seeing none, all those in favor, and that passes unanimously. And finally, Councillor Jolicoeur.
That council close the meeting to the public pursuant to the following subsection of the community charter. 91A, personal information about an identifiable individual who holds or is being considered for a position as an officer, employee, or agent of the municipality or another position appointed by the municipality. And that I, the receipt of advice that is subject to solicitor client privilege, including communications necessary for that purpose.
It's been moved and seconded. Any questions or comments? Seeing none, all those in favor? That passes unanimously, and we have adjournment. Thanks, everybody.